Welcome to today's listening session on the development of FDA's Center for Tobacco Products 5-year strategic plan. And thank you for joining us. I'm Sarah Lynch, commonly known as SJ, and I currently serve as the Division Director in FDA's Office of Operations, Office of Planning, Evaluation, and Risk Management, or OPRM here at FDA. OPRM provides expertise in strategic planning and other areas in partnership with FDA executives and senior managers. Over the last few months, my team and I have facilitated discussions with leadership and colleagues across CTP about the focus of the center's new strategic plan and key elements, as referenced in the public meeting notice. I will serve as session moderator today for the first and last hours of the listening session, with other FDA colleagues covering other time windows. The listening session provides the public an opportunity for open comment on the goals, themes, and focus areas of the plan that we are in the process of developing. Whether delivered verbally today, or in writing to the docket, we will consider your comments in further shaping the draft plan. As a reminder, the information to submit a written comment is also available on the FDA event page for this meeting. Today's session, as you can see, will be closed captioned and an ASL interpreter will be on the call. This meeting is also being recorded. A transcript and recording will be available on FDA's website in a few weeks. A transcript will also be accessible on regulations.gov. I now turn it over to CTP Director Brian King for a welcome and overview of some broader context and what we've done to develop the plan's draft themes, goals, outcomes, and objectives content.
Great. Thank you, SJ, and good morning, all. Thanks for attending today's listening session and for providing your comments as we develop the center's new 5-year strategic plan. Now, our priority today is to hear from the public, so I'm going to keep my introduction and remarks very brief this morning. So as I'm sure you'll recall, in September of last year, there was an independent expert panel that was facilitated by the Reagan-Udall Foundation that began an operational evaluation of our center at the request of FDA Commissioner Dr. Robert Califf. As I've noted many times publicly and also privately, I welcome this opportunity as the newly minted center director to help chart our path forward. And my perspectives have not changed on that matter. They continue to persist today. The final report was ultimately issued in December of last year, and it included 15 recommendations, all of which CTP has committed to addressing, and we continue to provide updates on that progress on a newly created website. And importantly, one of those recommendations from the report was the creation of a new strategic plan. And we've had previous strategic plans since the inception of our center and welcome the opportunity for an update, which was also particularly timely and appropriate given the arrival of new leadership at the center. Now, in terms of background, over the past several months, all CTP staff were given the opportunity to provide feedback in various ways on the draft content that we're going to be discussing today. In addition to the many valuable suggestions from staff across the center, which is critically important, public input is also important. And that's why we're here today, to request your input as we further develop the new strategic plan. Now, before I hand things over to get us started, I did want to walk through the 5 draft goal areas for the proposed strategic plan that you've all been provided with leading up to today's session. Now, the first is to develop, advance, and communicate comprehensive and impactful tobacco regulations and guidance. Now, this goal includes activities related to the development and implementation of CTP's regulatory and policy agenda, the articulation and publication of clear and comprehensive public policy statements, and also efforts to advance health equity. The second is to ensure timely, clear, and consistent product application review to protect public health. This goal includes activities related to work processes, such as optimizing the efficiency, consistency, and effectiveness of the product application review process, enhancing public understanding of regulatory requirements through transparency and stakeholder engagement efforts, and also ensuring that the review process is supported by a strong regulatory science program. The third is to ensure compliance of regulated industry and tobacco products utilizing all available tools, including robust enforcement action. This goal includes pursuing enforcement actions to reduce violations, enhancing collaborations with federal and state agencies on tobacco enforcement efforts, and prioritizing agile market intelligence and surveillance to facilitate awareness of and effectively responses to the evolving tobacco product landscape. And now the fourth is to improve public health by enhancing knowledge and understanding of CTP tobacco product regulation and the risks associated with tobacco product use. This goal includes timely, clear, and accessible health communications and education to diverse public audiences, including those to discourage youth initiation, encourage cessation, and to inform adults who smoke about the relative risks of tobacco products. And finally, the fifth is to advance operational excellence. This goal includes prioritization of workforce growth, engagement, and retention, and CTP's ongoing commitment to diversity, equity, inclusion, and accessibility. Also modernizing business processes to enhance information management and programmatic efficacy, and seeking and applying needed resources to support CTP's full portfolio of regulatory activities. Now, I do want to note that there's also several cross-cutting themes relevant across the 5 proposed goal areas that we'd like your feedback on today as well. And those include health equity, science, transparency, and stakeholder engagement. And before I begin, I do want to acknowledge that we received many requests to speak, and we have worked hard to accommodate every single one of them today. And so in doing so, we do have a packed schedule, and I encourage you to please stick to the time allotted so we can hear all voices who would like to comment on the strategic plan. I know there were many folks who signed up to listen in but didn't sign up to speak. That is a-okay as well. That said, I will emphasize that the docket remains open, and every person, group, or organization can provide written comments through August 29th of this year. And after that comment period closes, we're going to review the comments and take this input into careful consideration as we continue to develop the center's strategic plan. And following that input, we intend to publish the strategic plan by the end of this calendar year, and we are on track to do so. So in closing, I'm grateful to everyone for sharing your input with us today. We look forward to hearing a broad representation of ideas and perspectives during this session, which I have absolutely no doubts that we will see given the lineup today. And I will now pass it back to SJ, our first moderator, who will open the floor for comments. Back to you, SJ.
Thank you, Brian. We're ready to begin welcoming our confirmed speakers to provide their comments with some general and specific process parameters. First, all comments, please, should be forward-looking, constructive, and concise in addressing the following questions in the context of the goal-related information that Brian provided. As you can see on the screen, what key features, activities, or initiatives would you like CTP to consider as related to any of these proposed goal areas? Question 1. What are the measurable short and long-term outcomes for the proposed goal areas over the next 2 to 5 years? Question 2. What are the 3 specific actions CTP could take in the next 5 years that would have the most impact in significantly reducing tobacco-related death and disease? Question 3. And are there any important features, activities, or initiatives not encapsulated by these proposed goal areas that you believe CTP should consider as part of its strategic plan? At the start of your comment, please clearly state your name and the organization you represent, or please note that you're speaking in your individual capacity. Second, as Brian mentioned, please limit your remarks to 4 minutes or less. To assist commenters with timekeeping, we will notify you when 1 minute is remaining for your allotted time. To be fair and equitable to all speakers, given that we have accommodated many, if your remarks continue past the 4 minute time limit, unfortunately, your line will be muted and we will be moving on to the next speaker. Last, we recognize that there are strongly held views and perspectives on this topic. We're committed to ensuring that all views are shared respectfully and appreciate your assistance in achieving this. Now let's get started. Once your name or telephone number is called, you'll be unmuted so that you can comment. And we have a first up, Vasuki Patel. You have 4 minutes for your comment. Please proceed. I'll say it again, Vasuki Patel.
Hello?
Vasuki?
Hi, I apologize. There were some server issues. Okay, let me, thank you so much for letting me speak. My name is Vasuki Patel, and I am speaking as an individual. And I would, so let me start. In designing an effective program plan encompassing the strategic vision of tobacco management and regulation, it's imperative that first an owner with a co-owner with clear stakeholder constituents of each phase in the development life cycle be charted out with clear roles and responsibilities, scopes, and the mission vision statement. That being said, the outreach in communicating and deploying on the risks of nicotine products holds many challenges, given that the pre-pandemic models that may have started to gain traction based on the then social evolution and lifestyles deviated almost instantly during the COVID crisis with spikes in mental health concerns, general restlessness, and nicotine vaping usage. For almost 3 years, the US has struggled with a standstill and further complacency in depressive states due to forced social and physical lulls. After reviewing some statistics around tobacco usage and the CTP oversight, I strongly suggest and recommend that the CTP consider embarking on a design for a national awareness campaign related to a scope that comprises a small but sizable group for their strategic 5-year plan, that being drivers who use tobacco products while driving, with the goal of eventually regulating smoking in the car, making it possibly ticketable nationwide. The awareness campaign would go into effect with data collected via a comprehensive survey and an internal stakeholder deep dive where assessments on how to manage age groups or drivers who smoke, locations such as local and main streets where smoking while driving would be regulated or banned, the times of the regulations, fines, and finally protecting animal ecosystems by banning smoking from all parks, owned parking lots, and many parking lots at malls and or standalone department stores, where there may be families of ducks and other vulnerable animals walking around near or at their normal habitats. Smoking while driving can be quite common, and achieving success in curbing some of the smoking within the driver population may drive effective timed conditioning, where for those 10 to 15 minutes or 30 minutes to an hour, a driver could benefit from decreases in blood pressure by not smoking. Ideally, a smoker can do whatever he or she wants outside of driving, but if controls were to be placed around driving, the time not smoking in their car could add up in health benefits, albeit a little here or there. This kind of campaign for this small group could achieve some national success in a strategic and phased go live with granular demographic hotspots from the aggregation of the survey data and further collaboration from potential stakeholders such as major retailers who have pharmacies, malls, local law enforcement, and park systems, as well as sanitation and environmental. Finally, there could be the possibility of podcasts and other products that can be developed specifically from this campaign for the success of this campaign, where there could be beta testing and eventually offer drivers who smoke an opportunity to relieve any urges for the time they spend in their vehicles.
Rob Crane. Please state your name and organization, confirm that it is Rob Crane, share that you are speaking as an individual or an organization, and you have 4 minutes. Again, Rob Crane, please.
Good morning. I'm
Good
Rob.
morning.
You hear me now? Yes.
Yes, we can, sir.
I'm Rob Crane, a physician and retired professor of family medicine at The Ohio State University. I head up the Preventing Tobacco Addiction Foundation and its advocacy arm, Tobacco 21. I speak on behalf of them today. We work across the country to raise the legal sales age for all nicotine products and reduce retailer access to kids. Please note we don't use the term youth access because that implies kids are the problem. We commend the FDA and the Center for Tobacco Products and its robust efforts to inhibit retailer access and reduce the marketing and appeal of these deadly addictive products. We heartily applaud Dr. King and his leadership that has brought renewed determination to these efforts, but it has not been enough, not nearly enough. Innovation by the industry requires innovation by its regulators, and frankly, all of us are behind. The results of monitoring the future suggest that more than 20% of high school seniors are vaping, and YTS indicates that a third of those are addicted. This calendar year alone, FDA's contractors have done 64,000 underage compliance checks, revealing that 1 in 6 brick and mortar retailers sell underage. We believe this to be a gross undercount due to the unrealistic methodology of these compliance checks. But even at 1 in 6, this means full access to kids, as they will choose the retailers who sell. Only about 30% of kids say they get their products from stores, but their social sources generally do. And now, increasingly, kids are being supplied online. We're still over 2/3 of underage college students say they have fake IDs. We recommend anyone listening to go online and simply search "buy fake ID" to see how easy it is to obtain these. Given these facts, we have our 3 strong recommendations that should be incorporated into the long-delayed issuance of the Tobacco 21 regulations by the FDA. Number 1, the enforcement for brick and mortar underage sales and compliance checks must be tightened. This will also require congressional action, and the administration and the FDA should push next year's Congress to do so. Number 2, given the risks involved, there is simply no rationale for online, non-face-to-face sales of non-therapeutic nicotine. FDA has the authority to close these down and ban these sales. They should undertake these steps to do so immediately. Number 3, the problem of fake IDs is so overwhelming that the only possible solution is the use of real ID technology scanned at the point of sale. We thank you for your attention and hope to move forward with greater and more robust enforcement and determined efforts against nicotine. Thank you.
Thank you, Rob. Lindsey Stroud, you are up next. Please state your name and organization or share that you're speaking as an individual. You have 4 minutes for your comment. Lindsey Stroud, please.
Yes, can you hear? Oh, can you unhear? Yeah, you can hear me. Sorry, I'm on 2 computers, so thank you for your time today. My name is Lindsey Stroud. I'm director of Taxpayers Protection Alliance Consumer Center and a visiting fellow at the Independent Women's Forum and a board member at the American Vapor Manufacturers. The CTP at FDA is severely stunted due to various provisions in the 2009 Family Smoking Prevention and Tobacco Control Act. Firstly, the TCA was designed to limit the tobacco marketplace as an effectively favored few bigger companies at the expense of everyone else. The TCA stunts the FDA from being able to fully advance the development of tobacco harm reduction products. The act was signed 2 years after the introduction of e-cigarettes to the marketplace and long before novel products were introduced. Yet products introduced to the market after February 15th, 2007 are permitted to market their products as are required to apply to the FDA in order to gain market authorization. The very language in the TCA is confusing and misleads the public. According to line 46 of the TCA, manufacturers are permitted to market their products as approved by the FDA and may confuse and mislead the public. Yet numerous public health trade associations and harm reduction opponents continue to harp that because the FDA has not approved these products, they're just as deadly as combustible cigarettes. Ultimately, FDA has had a major failure in communicating to the public about the continuum of risk that exists among all tobacco products, a topic first really addressed in 2017 when FDA claimed the agency was developing a plan to strike, quote, an appropriate balance between regulations and encouraging the development of innovative tobacco products that may be less dangerous than cigarettes. Yet the agency has done a poor job at communicating these reduced harms. A recent global survey of more than 15,000 doctors found that 77% of them believe that nicotine causes lung cancer. A May study in the journal Addiction found that most adults who smoke cigarettes do not think that e-cigarettes have fewer harmful chemicals than cigarettes. Even the CTP director recently published commentary addressing these misperceptions, yet the agency's actions are leading to this confusion. There are two market pathways to bring a new tobacco product on the market. The substantial equivalent SE pathway or the pre-market tobacco product pathway, or PMTA. Between 2019 and 2022, the FDA issued 421 SE orders for numerous tobacco products, including 126 orders for combustible cigarette products. To date, FDA has only issued 45 marketing orders for products used using the PMTA pathway, and only 23 of them are for e-cigarette products. Only 3 major companies have received PMTA marketing orders for their e-cigarette products, compared to about 27 different manufacturers who received SE orders. FDA also continues to use as a reason for denying flavored e-cigarette products, yet the agency does not have a concrete definition on what defines youth appealing, and there is no definition for youth appealing in the TCA. For the past several years, it's issued warning letters and enforcement actions against flavored e-cigarettes, citing youth vaping epidemic. Yet it's actively ignoring survey data that cite that flavors are not the most commonly cited reason why youth use e-cigarettes. According to the National Youth Tobacco Survey, nearly half, 43.4% of current U.S. and middle high school students that were using e-cigarettes in 2021 cited using them because they were feeling anxious, stressed, and/or depressed. Only 13.2% cited using them because of flavors. Conversely, numerous adult surveys, countless studies, and the fact that the market is saturated with flavored products and adult e-cigarette use is increasing. Adults both enjoy and rely on flavors to quit smoking and remain smoke-free. And finally, most importantly, FDA must reform its budget process. The FDA is completely funded by user fees from 6 tobacco product categories, with 85% of its budget coming from combustible cigarettes. There's no incentive for FDA to authorize new products not subject to user fees, but it's also unfair that existing fees are being used for the enforcement action for non-user fees products. Also, it's rather ironic that FDA claims to want to advance public health and reduce smoking, yet its funding relies on the lungs of people who smoke. Again, FDA must reconcile some major flaws in the TCA in order to advance tobacco harm reduction for the million Americans who smoke. Thank you for your time today.
Thank you, Lindsey. Up next, we have Drew Newman. Please state your organization or share that you're speaking as an individual. You have 4 minutes. Thank you. Drew?
Good morning. My name is Drew Newman of Jace Newman Cigar Company, and I'm coming to you from our 113-year-old El Rolo Cigar Factory in the cigar city of Tampa, Florida. It's not a virtual background. Behind me, we're handcrafting cigars just like my great-grandfather did when he founded our company in 1895. I want to thank CTP for holding today's listening session, allowing small family businesses like ours to speak and share our views on the proposed goal areas of CTP's strategic plan. I've read through the 5 draft goal areas that Dr. King mentioned at the beginning and want to offer 3 things for your consideration. 1, please remember the continuum of risk. 2, we're an industry full of small businesses. And 3, compliance should include support, not just enforcement actions. First, when he announced his comprehensive regulatory plan for tobacco products in 2017, former Commissioner Gottlieb said, quote, "We must acknowledge that there is a continuum of risk for nicotine delivery." He noted that different products can have different levels of harm. And instead of taking a one-size-fits-all approach for all tobacco products, Dr. Gottlieb directed CTP to tailor its work to the unique characteristics of different types of tobacco products. He also recognized the agency has limited resources and directed CTP to focus its limited resources on the products in the continuum that have the greatest risk. In reading CTP's draft goal areas, I'm concerned that this philosophy has been overlooked. As the agency continues drafting its strategic plan, please recognize that tobacco includes a wide range of products, and adopting a one-size-fits-all policy will not work. Please include the continuum of risk in your strategic plan and let it guide the agency and direct CTP's limited resources so they can be used in the most efficient and effective way possible. Second, we're an industry full of small businesses. Section 900 of the Tobacco Control Act, Congress recognized that there are small tobacco product manufacturers. Section 901 directs FDA to establish a small business assistance office. Section 906 provides extra time for small businesses to comply with new regulatory requirements. Small businesses and consideration for them are throughout the Tobacco Control Act, and they should be a part of the strategic plan as well. I'm concerned that CTP's draft goal areas don't reflect this and don't reflect the fact that we are an industry full of small businesses. Of course, there are big tobacco companies. However, I would bet that there are thousands of small businesses like ours that grow, make, or sell tobacco products for every giant tobacco product company that exists. For example, we buy our leaves from small family companies around the world, and the vast majority of our cigars are sold by 3,000 family-owned brick-and-mortar cigar stores in the USA. Lastly, the proposed goal area on compliance is pretty intense. What I read is an aggressive focus on going after bad actors. Of course, there are bad actors in every industry, and CTP should have robust tools to address them. However, compliance should include more than just legal actions and penalties. Most people in this world are good people, and I know a lot of good people in the tobacco industry who want to do the right thing, but sometimes don't always know how. As a small business, it can be tough to understand how to comply with hundreds of pages of dense regulations that grow every year. And so as you think about compliance, please include processes that help regulated businesses to understand errors and deficiencies and give them a chance to correct them and come into compliance before the heavy hand of government comes down on them. Thank you so much for this opportunity.
Thank you. We are now moving to JB Simcoe. Please state your organization or indicate that you're speaking on as an individual. You have 4 minutes. Thank you.
Good morning. This is JB Simcoe with Philip Morris International. Thanks so much for your time today. Both PMI and our new affiliate, Swedish Match, share a commitment to support a workable FDA process and a fully regulated market. We're far from that goal today. Each year, the vast majority of adult smokers will continue smoking, and they have very few FDA-authorized alternatives available. CDC's most recent estimate of smoking-related deaths per year is almost 500,000, and this number has never gone down. To meaningfully change this trajectory, CTP must prioritize authorizations for a range of smoke-free products as alternatives to cigarettes. As a product regulator, CTP must be pragmatic in its interpretations and change how it reviews smoke-free product applications. The current approach is favoring combustible cigarettes. CTP could make 3 important changes within the strategic plan. First, CTP should empower the Office of Science as the final decision maker for the majority of smoke-free product applications. CTP has faced backlogs before. For combustible products, CTP empowered OS with decision-making authority, and OS created an efficient review process. Unfortunately, this is for the most harmful product formats. Now is the time to prioritize smoke-free products. We encourage CTP to survey the 500+ scientists in OS and rely on their experience and scientific expertise to gauge whether application decisions align with the available science, and if not, what changes are needed to be efficient, fair, and transparent. OS has the core expertise to decide certain applications on its own. PMTAs that don't involve flavored vapor products. Applications should not be delayed by vapor-specific concerns if there is no significant underage use being observed for the candidate product or category. These should follow the science and be decided by OS within the 180-day deadline. Supplemental PMTAs. These products have already demonstrated they are APPH and seek minor changes to improve product quality and rates of complete switching among adult smokers. They should be expedited through OS. Combined PMTA MRTP applications. These products present the greatest potential to benefit public health. This pathway is underutilized today. Prioritization through a single review team could incentivize its use. Our second recommendation is that CTP should create a new performance measure focused on the number of smoke-free product authorizations. To date, FDA has primarily measured its performance through millions of refusals and denials. Meanwhile, thousands of combustible products have been authorized with great efficiency. A better measure of performance would be comparing the number of smoke-free product authorizations to combustible products. Improving this ratio is critical for changing the trajectory of smoking. After authorizations, CTP can then focus on communication. FDA's plan to educate adults on the risk continuum is an important first step, but it's unlikely to move very fast. Our third recommendation as a near-term action would be to communicate directly with medical professionals. Recent studies have shown serious misperceptions. Targeted communications of basic information for the medical community could easily start this year. Last, I'm sure you'll hear a lot today about enforcement. Access to and information about authorized products helps close the door on illicit products. We offer these near-term suggestions for the plan as a way to massively disrupt the current trajectory of smoking, and thank you for your consideration.
Thank you, JB. Keith Churchwell, please state your organization or share your speaking on as an individual. You have 4 minutes. Keith Churchwell, thank you. Sir, we cannot hear you yet.
Can you hear me now?
Yes, we can, sir. Thank you.
Thank you. Good morning. Thank you for the opportunity to present the views of the American Heart Association. I'm Dr. Keith Churchwell. I'm a cardiologist and also the president-elect of the American Heart Association. AHA is pleased that the Center for Tobacco Products is developing a strategic plan and inviting public input. A plan that includes bold policies that is informed by the best available science, that adapts to changes in the marketplace, and most importantly, that prioritizes public health will help CTP achieve its mission. Today, I would like highlight elements we believe should be included in 2 of the proposed gold areas. For the first proposed gold area, development of regulations and guidance documents, CTP should prioritize the development of product standards, including final product standards that prohibit menthol as characterizing flavor in cigarettes and all characterizing flavors in cigars, and a nicotine standard for combustible tobacco products. CTP should also release the Tobacco 21 final rule. While this rule may seem unnecessary because the law took effect immediately in 2019, a few states are still not enforcing 21 as the minimal sale age because they're under the impression they must first change state law. A final rule or FDA guidance could clarify this for states. For the gold area on compliance and enforcement, CTP must prioritize removing products without FDA authorization from the market. To do this, FDA should, number 1, publish and widely distribute a list of tobacco products that can be sold legally and clearly state that products that do not appear on this list cannot be sold and must be removed from store shelves. Number 2, monitor trade publications and industry social media accounts for new products being marketed without FDA authorization, and immediately inform manufacturers that these products must be removed from the market. Number 3, take enforcement action against wholesalers and distributors who distribute illegal products, keeping these products from ever reaching retailers and consumers. And number 4, increase coordination with state and local enforcement officials. AHA will provide recommendations for the other goals in our written comments. But I would like to discuss 2 additional elements not covered by the proposed gold areas that should be included in the strategic plan. The first is tobacco cessation. CTP must consider the downstream implications of its policies. Removing menthol cigarettes and flavored cigar and lowered nicotine in cigarettes will have a huge impact on tobacco-related death and disease. But we first must provide tobacco users with more tools to quit. CTP should work with the Center for Drug Evaluation and Research to encourage innovation and accelerate approval of new cessation therapies. A second related area is to clearly articulate in the agency's plan to drive down tobacco and nicotine use. This should include CTP's thinking on how to best minimize the use of combustible products while ensuring that other products do not attract youth, and the role, if any, of modified risk or harm reduction products. It should also identify areas where additional research is needed to inform CTP policy. I'll close with this final thought. This strategic plan will set the direction for CTP for 5 years. It is incredibly important that we get it right. So I encourage you to focus the plan on one overarching goal, protecting the public's health. Thank you for allowing me to share the views of the American Heart Association.
Thank you, Dr. Churchwell. Anna Melendez, please state your organization or share that you're speaking as an individual. You have 4 minutes. Anna Melendez, please.
Hello, can you hear me?
Yes, ma'am.
Oh, perfect. Okay. Good morning. My name is Ana Melendez, and I am the president of the Florida Association of Wholesale Distributors. Prohibition is not the answer. FDA should not ban the legal distribution of menthol cigarettes and flavored cigars. This prohibition-based policy makes no sense because it will push these products out of licensed distributors to unregulated, illegal markets, undermine the public health purposes of FDA regulation and other laws, put $18 to $19 billion in wholesale value risk from menthol cigarettes and flavored cigar sales. FDA has better options that don't hurt licensed distributors, like education, cessation support, and underage prevention. That's what FDA should focus on, not prohibition. Licensed wholesalers are essential to proper regulation of tobacco products. The licensed wholesale system is a critical component of ensuring all tobacco products are responsibly distributed and sold in the US. It is through licensed distributors that FDA and other government agencies ensure adult consumers receive products that are made only by FDA regulated manufacturers in compliance with FDA health warning requirements, not adulterated or misbranded, fully tax paid, in compliance with master settlement agreement requirements, distributed to licensed retailers required to age verify the sales. The distributor community has been key to making progress on the public health goals of FDA regulation. Among other things, youth cigarette smoking is the lowest in a generation, 1.3%, as is youth menthol cigarette use, 0.8%. There is a better path forward. FDA has better options for protecting public health, which keep these products within the licensed regulated system. FDA should focus on education, cessation, underage prevention, and providing adult consumers less harmful alternatives. These harm reduction policies preserve age verification at retail, ensure all products are FDA regulated, inform adults of the health risks of different products, don't lead to more illegal sales and crime, don't hurt responsible distributors and retailers. Regarding e-vapor and the need for FDA authorization and enforcement, over 97% of the e-vapor products on the market today lack FDA authorization after more than 2 years of FDA product reviews. FDA has denied or delayed action on vast numbers of products, even those with compelling evidence they are effective harm reduction solutions for adult smokers. Consumers are now turning to rapidly growing illicit markets and products, a circumstance FDA has said would endanger public health. FDA has been unable to remove illegal products from the system or prevent illicit channels, nor is FDA empowering wholesalers and retailers with the basic information they need to remove illegal products from the systems on their own. With an illicit e-vapor market growing, FDA should urgently adopt a more effective approach to enforcement. Among other things, FDA should publish a list of brands in compliance with the 2020 guidance to enable licensed retailers and wholesalers to sell only compliant products. Work with other federal and state agencies to carry out effective measures to prevent illicit products from entering the US at the borders. Collaborate with and provide funding for state law enforcement agencies to assist in bringing the e-vapor market into compliance with federal law, including amending its retail inspection contracts to include surveillance of non-compliant products. There's no bigger challenge facing federal tobacco regulation today than the need to bring regulatory coherence and support to the e-vapor market. Thank you so much for your time.
Thank you, Anna. Much appreciated. Nikichi Taifa. Nikichi Taifa, thank you for joining us earlier in the day. Please state your organization or share that you're speaking as an individual. You have 4 minutes. You are on mute yet.
I'm trying to unmute myself. Can you hear
You're
me?
good. Yeah, we can hear you, ma'am.
Here I am.
Thank you.
Okay, on behalf of myself, Nikichi Taifa, a veteran criminal justice advocate, founder of the Taifa Group and Justice Roundtable convener emeritus, I welcome the opportunity to provide my perspective as the FDA Center for Tobacco Products embarks on its 5-year plan. Over my 40-year professional career as a criminal justice advocate, I have witnessed firsthand that well-intentioned policies geared at eradicating drug abuse, when rolled out incorrectly, have devastating effects on communities of color across the nation. The war on drugs of the 80s and 90s, aimed at addressing the crack powder epidemic, accomplished very little in terms of getting at the root causes of addiction to crack and powder cocaine. Instead, what we saw was a whole generation of Black men and increasingly Black women losing their lives to incarceration for mostly nonviolent drug offenses. This has a direct correlation to the current FDA proposed menthol ban. I urge the FDA, as it thinks about the next 5 years, to take a more holistic look at what a seemingly well-intentioned policy may cause, especially to underserved communities of color. Having grown up in a household where my parents smoked, I have always abhorred smoking. As such, I applaud the FDA for the significant progress made in reducing cigarette smoking in the United States over the past 2 decades. This has been accomplished with policies emphasizing education, cessation, underage prevention, and other measures that allow for continued regulated pathways to adults 21 and older. These health gains have not been accomplished through prohibition, criminalization, and incarceration. The FDA proposed menthol ban would trigger hundreds of federal, state, and local laws criminalizing the distribution, sale, and mere possession of illicit tobacco. While an effective FDA menthol ban would activate these statutes, the FDA would have no authority over how these statutes are implemented in states. If a quarter of current menthol smokers continue to smoke menthol after a ban, 4.8 million US residents would be subjected to potential arrest and incarceration, including my parents, if they were still alive. Moreover, the proposed menthol ban would undermine attempts to course correct on cannabis, slow mass incarceration for minor offenses, and reduce reasons for police and citizen confrontations. It is counterintuitive to promulgate a sweeping new prohibition when Congress is debating how and when to discontinue cannabis prohibition and sanction legal regulated adult sale in order to reverse the human catastrophe of decades of criminalization. And while many states have already created regulatory frameworks favoring a regulated and taxed marketplace for cannabis over illicit trade. In closing, I would like to submit to the docket a sign-on letter released in June 2003, addressed to President Biden, Secretary Becerra, and Commissioner Califf, signed by over 54 national and local organizations expressing their concerns with the menthol ban. We believe that a better way forward to curb smoking is by implementing harm reduction and other public health strategies, including education and youth tobacco prevention, rather than punishing behavior using the criminal justice system, which has proven time and time again, simply does not work. Thank you.
Thank you very much for your comment. Up next, we have McCarthy.
Hi, can you hear me?
Yes, thank you. My apologies. I just got a pop-up that indicated my Zoom quit unexpectedly, so I was waiting to see if it actually did. Hello, Jim.
Hi.
Thank you. I keep getting the pop-up, so I'm going to.
You tell me when you're ready. You tell me when you're ready.
Go ahead, sir.
Okay. Thank you for including us today. My name is Jim McCarthy, and I'm here on behalf of American Vapor Manufacturers. We are the leading trade association for the vaping industry. One of the challenges, I think, for bureaucratic agencies like FDA is that it's easy to get lost in the tangle of rules and details and procedures. So instead of focusing on that minutia, I would like to back the frame out and talk about the big picture for just a minute. There's an apparent and obvious approach that the agency is using in its posture toward vaping products, which can be summed up as better safe than sorry. In academic jargon, the agency and the news media use, that's called the precautionary principle. That may seem like a noble intention, but what counts in the real world is not the intentions, but the outcome. There are millions of Americans that have successfully quit smoking by switching to nicotine vaping. Yet you have outlawed the products they rely on and bankrupted the businesses where they obtain those products, casting countless numbers of them back to combustible cigarettes. There are millions of other Americans who continue to smoke cigarettes because they wrongly believe that vaping is somehow more dangerous than smoking. And it's not just ordinary people with that lethal misconception. The vast majority of physicians in this country falsely believe the same thing, and even that nicotine causes cancer. The blame for that horrendous misconception must be laid at the doorstep of FDA. No public authority or institution has done more to demonize nicotine vaping. And I mean that literally. FDA has an active, big budget ad campaign running nationally that compares nicotine vaping to being possessed by demons. And here's the outcome. Countless Americans that could be saving their own lives by switching to nicotine vaping are instead suffering from cardiopulmonary disease and dying from cigarette smoking. In other words, FDA's precautionary approach fails on its own terms. That's because Americans are actively suffering disease and death when they are deprived or discouraged from switching to low-risk alternatives. The harm you are cautious about is already happening on a vast scale. It's not just us in the nicotine vaping industry who are pleading with the agency to recognize the ongoing harm that you're perpetrating. Leading commentators across the ideological spectrum are saying the exact same thing. That includes, for example, decorated writer Mark Gunther, the leading science journalist in the country, Seth Mnookin, legendary New York Times columnist John Tierney, syndicated writer Veronique DeRougy, veteran columnist Holman Jenkins, author Michael Moynihan, esteemed constitutional law scholar Jonathan Adler, author and columnist Noah Rothman. Notice there's no other issue in American public life that has that range of consensus among leading public affairs intellectuals. And that's why it is the leadership of the agency today, Dr. Califf, Dr. King, Matthew Farrelly, that are going to be held directly responsible for the vast harm that is occurring on their watch. That is the legacy they are building. Just last week, Dr. King published an essay in the medical journal Addiction, in which he lamented how Americans are misinformed about nicotine vaping. Yet just 2 days later, Senator Richard Blumenthal held a press conference and yet again brazenly deceived the public about the rates of youth vaping. When we reached out to FDA leadership and media relations, urging them to set the record straight on their own data, we got no response, no action, and the agencies have still done nothing. The public reputation of FDA is already fractured, but the agency's blinkered intransigence on nicotine vaping is a failure of historic proportion. So my suggestions are sober up, get your act together, and start telling the truth to the American public about nicotine vaping.
Thank you, sir, for your comments. And thank you to all of the panelists for our first session. We will take a break until a couple minutes before 11 to 11, and we will begin in our return with Jeff Steier and a new moderator. Thank you very much again for your comments, and we will take a short break.
Hello, welcome back. I'm Vanessa Burrows from the FDA. Next up, we have Jeff Steier. Please state your name and organization or share that you are speaking as an individual. You have 4 minutes for your comment. Please proceed.
Thank you for, I should be unmuted now. Can you hear me?
Yes, we can hear you. Please go ahead.
Thanks. Hi, I'm Jeff Steier. I'm representing myself today, but speaking on behalf of thousands of smokers I've talked with and heard from over my career in public health. Of the 5 goals in the strategic plan, one goal is conspicuously absent. There must be a 6th goal, and that is to use the best science to proactively harness the public health benefit of tobacco harm reduction and integrate that into each of the other 5 categories. Without specifically incorporating tobacco harm reduction into this strategic plan, the plan is simply window dressing for the approach that got the CTP into the mess it's currently in. The Reagan-Udall report, which prompted this strategic plan, a report that the FDA itself asked for, makes it clear that we don't need window dressing. We need specific changes with firm accountability. This is necessary because to date, the CTP has already been engaging in activities in these 5 categories, but has failed to meaningfully incorporate harm reduction into these plans, except in circumstances where the law absolutely required it. And as evidenced by CTP's many losses in legal challenges in the courts, the CTP has even violated the law in its misguided opposition to tobacco harm reduction at almost every regulatory turn. Commissioner Califf recently claimed that misinformation is the leading cause of death in the US. Oh, the tragic irony. FDA has contributed to the misinformation about the risks of nicotine products, vis-a-vis the risk of smoking versus e-cigarette. Smoking being a leading killer in the US, e-cigarettes not being a leading killer in the US. And despite the FDA's acknowledged awareness of how woefully unaware smokers are about the clear benefits of switching to e-cigarettes completely, the FDA has failed to fight the misinformation that is truly killing people and keeping them smoking. I'm sad to say that the FDA's words and actions since the Reagan-Udall report offer little evidence of either contrition or reform, but a careful reading of the agency's statements alongside a batch of marketing denial orders issued in May 12th for 6,500 flavored e-cigarettes, I think gives insight into the agency's regulatory stance, as well as where it might see itself as most vulnerable in the courts. First, Director Brian King stated, quote, "It is the applicant's responsibility to provide scientific evidence to demonstrate that marketing a new tobacco product is appropriate for the protection of public health." This is indeed longstanding FDA policy. However, had the agency been executing a strategic plan which followed its own July 2017 comprehensive plan for tobacco and nicotine regulation, the FDA might have acted differently. The 2017 plan envisioned moving adult smokers down a continuum of risk to FDA authorized non-combustible nicotine products. Towards that end, the agency must see applicants as potential public health partners with the agency to implement the strategic plan that includes tobacco harm reduction. All I can say is that without incorporating tobacco harm reduction into this strategic plan, we are left with window dressing and the same problems that got us into this situation in the first place. Thank you for listening.
Thank you for your comment. Up next, we have Tony Abood. Please identify your organization or state that you are speaking as an individual. You have 4 minutes for your comment. Please proceed.
Good morning. Can you hear me?
Yes, we can. Please
Okay.
proceed.
Thank you for the opportunity to provide input on the strategic plan. My name is Tony Abood. I am the Executive Director of the Vapor Technology Association, which is a United States-based trade association of companies in the independent vapor industry. I'll address 3 core priorities in CTP's creation and implementation of the plan. First, the agency needs to immediately, loudly, and repeatedly announce its commitment to the principles of harm reduction, and in so doing, loudly and repeatedly communicate the public health goal of reducing risk through the use of vaping and modern oral nicotine products. If this is not the centerpiece of CTP's messaging and strategic plan and announced as such, then the cacophony of misinformation regarding less harmful nicotine alternatives, about which Director King has lamented himself, will simply undermine whatever strategic plan CTP eventually puts in place. Second, the plan must fix what can only be considered a broken PMTA process. A couple points here. One, the RUF, the Reagan-Udall Foundation, critiqued CTP for having undefined application requirements. They said, quote, applicants will struggle to address the issues necessary to meet the APPH standard unless FDA clearly articulates its expectations. CTP has a responsibility to clearly identify application requirements, if for no other reason than to reduce the burden on the agency itself and improve efficiency, close quote. But there's a more important reason. A scientific regulatory scheme which purports to determine what is appropriate for the protection of public health, but which does not specify the science that is necessary for making that assessment, is ultimately ineffective and subjective. CTP's plan must include a specific and finite list of studies and data which is required to support an APPH determination and which, if provided within certain parameters, will be sufficient for CTP's evaluation and issuance of a marketing order. Two, RUF's critique also was clear on the fact that CTP's plan must, quote, explain how FDA is interpreting the APPH standard. The key question, they said, is, quote, how to weigh the public health benefits of the percentage of adults who use ends that will completely quit smoking combustible tobacco products against the potential public health harms that youth who use ends will acquire lifelong addiction to nicotine or proceed to use combustible products. End quote. To that end, CTP must clearly end its current subjective application of APPH, in which it has proclaimed that all flavored ends products are attractive to youth, regardless of the specific product at issue in the application, and regardless of that product's experience, if any, with youth. This presumption is made without any reference to the product at issue or to science, and thus is entirely unscientific and evidence of a double standard. Very simply, the presumption imposed in CTP's July fatal flaw memo is no longer defensible in light of the RUF's findings. CTP can and should establish an objective assessment mechanism for evaluating each of the scientific studies presented on each of the prongs of the APPH test that ultimately results in a score for each product's application based on an objective, not subjective interpretation of the science presented. Third and finally, meaningful change will not come unless CTP implements safeguards to ensure that the review process is insulated from external pressures that were noted by the Reagan-Udall Foundation, and that CTP scientists are allowed to unapologetically follow the science. The revelations of FDA's own scientific staff about political interference in the PMTA process must be dramatically and finally addressed. Scientists must be allowed to complete its reviews of applications without interference or changes in review protocols were not in place prior to the applications being filed. Thank you very much for the opportunity.
Thank you for your comment. Up next, we have Stacy Gagosian. Stacy, please come on the microphone and state your organization or whether you're speaking as an individual. You have 4 minutes. Please proceed.
Today on FDA's goal areas that FDA has made public are generally a good place to start. These will ensure that FDA CTP can fulfill its overarching objective, which is to protect public health with regard to tobacco and nicotine products. As FDA further fleshes out its strategic plan, it will be important to ensure that there are strategies and metrics associated with each of these goal areas. Truth Initiative will submit written comments that will provide more details, but in the short time we have today, we wanted to highlight a few things. First, eliminating health disparities associated with tobacco use and tobacco-related disease must be fundamental to each and every one of these goals. It is mentioned in the regulation goal, but it needs to be part of all of these goals. Populations targeted by the tobacco industry, including Black Americans, Hispanic and Latino communities, American Indian and Alaska Natives, youth, and others have long faced disproportionate burden from tobacco-related death and disease. And as a result, all actions that FDA CTP takes must be viewed through an equity lens and ensure that regulations, research, and other activities CTP takes on will support these populations and reach the people who are most impacted by tobacco and nicotine use. Second, we fully support FDA's goal to develop, advance, and communicate comprehensive and impactful tobacco regulations and guidance. It is vital that, as noted before, that there are metrics and deadlines associated with these rules. These measures have the ability to save lives and reduce the disease and death associated with nicotine and tobacco products. FDA must ensure that its research programs and regulatory and legal teams are all working together, not in silos, but together to ensure that rules, guidance, and other measures are based in science, help those who are most impacted by tobacco, and are legally defensible, as we know that FDA actions are often litigated by the industry. We are also very concerned about the product application review and enforcement processes. Oh, I'm sorry, I didn't see the start my video. It is critical that FDA CTP get the application review process under control so that consumers, the public, and even the industry knows that the products we find on the market are those that have been reviewed by FDA and determined to be appropriate for the protection of public health. The situation we have right now is far from that, where products with the highest market share are on the market completely unreviewed. Further enforcement is needed to keep illegal products off the market. We know that there are more products, more brands, and the industry is flooding the market with new products. And this highlights the need for FDA to take action to prevent these products, all of which are illegally on the market, from getting into the hands of young people. FDA needs to shore up these processes. Finally, we were concerned to note that there was no mention of tobacco and nicotine cessation in the goal areas the FDA released. This is short-sighted, and while CTP doesn't provide cessation services directly, its actions through regulation and product review play a huge role in the demand for cessation treatments. It is imperative that CTP work with sister agencies within FDA as well as with other government agencies to ensure that those who use tobacco and nicotine products have access to the tools they need.
Thank you for your comment. Up next, we have Farhana Haseen. Please come on the microphone and or video and state your organization and or if you are speaking as an individual. You have 4 minutes. Please proceed. Farhana Haseen. Farhana Haseen, are you available to make your comment? We'll move on to the next commenter then. Up next, we have John Ma. Please identify the organization you represent, or if you are speaking as an individual. You have 4 minutes to make your comment. Please proceed.
Good morning. My name is John Ma. I was the 2018 president of the San Francisco Marine Medical Society. I'm speaking as an individual. I appreciate the opportunity to speak today. I applaud Commissioner Kayla's vision to pivot to a proactive position. I'd like to share a recent update about a long-awaited advance in tobacco control from the Netherlands, following a decades-long effort there to address what is known as the low tar myth. A Dutch court recently heard final arguments in a case that may mandate more accurate methods to analyze the levels of tar, nicotine, and carbon monoxide, known as TNCO, from cigarettes thereby requiring tobacco companies to redesign cigarette filters or modify cigarette composition to reduce the levels of toxic chemicals to which smokers are exposed. I believe that this breakthrough can serve as the future blueprint for this FDA and CTP over the next decade. The story began in 1936 when researchers developed a method to analyze cigarettes for TNCO. The protocol was adopted by the US Federal Trade Commission in 1967. Cigarettes are held by a machine, then simultaneously ignited and puffed by syringes, a 35 cc volume over 2 seconds, just once a minute, until a prescribed short butt length is reached and the particulate components of TNCO are collected. This FTC method has since been adopted around the globe. It's known in Europe as the International Organization for Standardization Method, also the ISO. But this mechanized smoking is unlike human smoking. It underestimates the exposure to toxic chemicals. Extensive research shows that smokers inhale deeper than a 35 cc volume and puff more frequently than once a minute. More serious concern exists about how the tobacco industry has evaded the test, as reported by 60 Minutes in 2001. Small ventilation holes and filters are created by lasers away from where the machine holds a cigarette, allowing external air to dilute the smoke stream, resulting in artificially lower TNCO measurements that comply with allowable standards. Smokers largely close these holes with their fingers or lips when inhaling and thereby are exposed to far more than the allowable limit. For decades, there have been calls for the FTC method to be replaced with a more accurate method that corrects for puff volume and blocks these holes. The tobacco industry has long been aware of the problem, and internal industry documents stated people smoking away so that they get much more than predicted by the machine. But the industry used this inaccurate data to market light and low tar cigarettes, misleading smokers into believing that these were safer. For their own internal research, the industry created their human smoking simulator, which recorded tar levels more than 3 times higher. But industry lawyers concluded they did not have any obligation to inform the public of the higher numbers, keeping the truth of the health danger secret for decades. In 2016, Dr. Jeffrey Wygand demonstrated to Amsterdam public health leaders how the measurements were manipulated by ventilation holes. Armed with this knowledge, leaders initiated a 2018 case to require testing with the new method. They were aided by scientific data that tested 100 different cigarettes by the WHO method, which comes closer to actual human smoking behavior, and found that almost all cigarettes exceed legal standards 2 to 3-fold. In 2022, an EU and Dutch court both ruled that a more accurate method should be adopted. The remaining question is whether the Netherlands will test solely the method. A final decision is due in November of 2023. The courts there could mandate that the WHO method be adopted all across Europe and to comply with emission levels according to that standard. The industry may be required to remove cigarette filters, stop placing ventilation holes in the filters, reduce TNCO levels, or a combination of these. 13 nations in Europe have now called on the EU to adopt the WHO method. In the US, the FDA and CTP should call on Congress and the FTC to adopt the WHO method as well. The Biden administration should join the WHO Framework Convention on Tobacco Control and end the use of the FTC method around the globe. Ultimately, the Dutch court decision is the key in mandating a more reliable method to test cigarettes and improve the health of smokers globally. Thank you.
Thank you for your comment. Up next, we have Elliot Boyce. Please identify your organization or state that you are speaking as an individual. You have 4 minutes for your comment. Please proceed.
Hello, my name is Elliot Boyce. My company is Diverse Perspectives. It's a law enforcement type consultant company, which basically offers consultant information for police officers as it pertains to racial profiling, recruitment and retention, diversity, equity, and inclusion within law enforcement. I'm opposed to the ban, not a supporter of smoking in any way, shape, or form. I don't smoke, but having served in law enforcement for over 35 years, I realized something very important. Anything you ban, you make illegal. Anything that's illegal is subject to police enforcement. This ban is going to add another healthcare concern to law enforcement's plates, where police officers are already taxed around the country with doing a variety of different things like dealing with mental health issues, which concerns me. Not only that, anything that you ban, you increase the chance of particularly popular products like menthol cigarettes. You increase the chances of individuals more increasing smuggling, increasing violence in the neighborhoods that's going to be subjected to these bans. As the doctor said before, just previous to me, he mentioned smokers. He talked about smokers as a whole, not those who smoke menthol predominantly. So why that's really important is individuals that do not smoke menthol cigarettes will not be subjected to these bans. Individuals that do smoke it will be subjected to them. What that means is there's going to be police enforcement in urban areas where over 80% of the individuals smoke menthol cigarettes. That is a problem. Not only will it be more enforcement, there'll also be more drug smuggling, more menthol cigarette smuggling. At this point in time, the FDA has a real good plan as far as regulating these cigarettes. If you ban them, now we're not going to know what's being put in these cigarettes. So my concern is the increased enforcement, the mental health issue, and not only that, the aspect that law enforcement officers are going to be put in harm's way because of the officer safety issue as they continue to try to combat against this. I read the domestic settlement agreement of 1998, I believe it was, deals with making sure that particular communities or any communities could no longer be targeted. So there's no more advertisements, there's no more sports figures, there's no more, rappers that can promote cigarette sales, only point of sale. With that type of control and FDA levying fines against individuals that do violate the rules, this is a better control. Putting out a ban without clear education, treatment, and counseling services for the individuals or the population that use them is reckless. And we cannot have a reckless situation because lives depend on it. We've had one situation where individuals lost his life already, that's Mr. Gardner in New York, over a nonviolent crime of selling or allegedly selling Lucy cigarettes. We can't afford to have that again. Police commissioners from around the country are not prepared to deal with this type of engagement, and they shouldn't have to. Not only with the master settlement agreement, what you do is you're subjecting individuals to basically going to the streets to buy their cigarette of choice, which is not fair. You can't have one community, which for the most regards would be predominantly the white community, being able to smoke cigarettes, while African American community is subject to criminalization. It's a real dangerous form. We have to be cautious of it. Along with that, if you do education, treatment, and counseling, one of the things someone has talked about, I saw in the CDC report, was the #1 cause of death for Americans, particularly African Americans, was cancer-related illnesses. The truth is, the #1 cause of death for African Americans from ages 1 to 25 is homicide. You add menthol cigarettes as a ban to it, you're going to increase that number, and we can't afford that. Please rethink this and do not ban menthol cigarettes. Thank you.
Thank you for your comment. Up next, we have Willie McKinney. Please identify your organization or state if you are speaking as an individual. You have 4 minutes for your comment. Please proceed. Willie McKinney, are you available to make your comment?
You hear me?
Now we can hear you. Please proceed.
Thank you. Thank you for the opportunity. We're grateful for the opportunity to provide comment on the Center for Tobacco Products Comprehensive 5-Year Strategic Plan. I'm Dr. Willie McKinney, the CEO of McKinney Regulatory Science Advisors, a privately held company with the core goal of helping manufacturers responsibly bring harm-reduced tobacco products to market. Today, I comment mainly on strategic goals 1 and 2, since these goals have the greatest impact on the work that McKinney undertakes for its clients. So how might the CTP develop, advance, and communicate comprehensive and impactful tobacco regulations and guidance? FDA could support this strategic goal by having a task to modify its review approaches for the administrative phase of a PMTA. We've had the opportunity to review PMTAs prepared and submitted by others. So we understand that if applications are not structured in a certain way or complete, the reviewer will have a very difficult time understanding the information. Frequently, we hear that filings are rejected for acceptance based on administrative issues such as the use of the wrong version of a form. It is unfortunate that products that have the potential for the greatest positive impact on overall public health are rejected at the first PMTA hurdle. This could be avoided by measuring the effectiveness of communications with industry stakeholders. Continual submissions of incorrect forms could signify ineffective communications. To rectify this, the FDA should consider introducing web portals that mandate the input of accurate information before generating a fully completed form. A similar web-based portal system used widely within the European Union for scientific data set submissions has proven efficient in streamlining the submission process and minimizing errors. So how might the CTP ensure timely, clear, and consistent product application review to protect public health? FDA could support this strategic goal by having a task to modify its PMTA categorization and prioritization approaches. Based on CTP's September 2020 stated priorities, the PMTAs of some tobacco products, such as oral nicotine products, appear to be the last products to enter the review process. Additionally, small manufacturers of other tobacco products, such as e-cigarettes, have found their PMTA stuck in the review process, even after robust deficiency responses. These manufacturers have no indication of when their applications will be processed or completed. CTP should consider a separate PMTA review lane for small manufacturers in order to address this uncertainty. Furthermore, it's not clear if manufacturers of oral nicotine products and others that don't have a youth use issue should submit data demonstrating an increased public health benefit of their non-tobacco flavored products. CTP should continue providing greater clarity on this issue in order to address this confusion. Lastly, the impact of delayed regulatory decisions and ambiguous communications can lead to unintended consequences. Harm reduction requires manufacturers to innovate and bring to market novel alternative tobacco products. For small manufacturers, innovation requires external investment. The prevailing regulatory uncertainty hampers the ability of small companies to secure funding. This can lead to fewer life-saving alternatives for adult smokers and the disappearance of small businesses that are critical to cigarette use reduction. Enhancing communication clarity with small businesses by CTP could help address uncertainties, thus facilitating the achievement of the agency's strategic goals. Thanks for the opportunity to share.
Thank you for your comment. Up next, we have Joshua Habursky. Please identify your organization or whether you're speaking as an individual. You have 4 minutes. Please proceed.
My name is Joshua Habursky, and I'm the Deputy Executive Director for the Premium Cigar Association. The PCA is a leading trade association representing over 3,000 retailers and over 250 manufacturing partners specializing in premium cigars and pipe tobacco. Following the decision of CAA et al. Versus Food and Drug Administration, the Center for Tobacco Products should make sure future initiatives do not attempt to regulate or have the tangible effect of regulating premium cigars. Some of our retail members carry products outside the scope of the recent court decision. Our association is weighing in on the CTP's strategic plan concerning regulating these products, such as pipe tobacco. With respect to the CTP's proposed goal areas, we offer the following recommendations. Goal 1, data-driven policy. Political objectives promoted by activist organizations should not guide policy development, especially when it directly conflicts with prevailing scientific research. The agency should reprioritize the policy agenda to focus on tobacco products at the highest end of the risk continuum. Goal 2, for products required to submit a pre-market review application, CTP should assess the costs and benefits of these regulations, including the coordination with the Small Business Administration and conducting a small business impact review, international commerce and trade impact review, and environmental impact review. Since CTP has not performed these requisite actions for the proposed tobacco manufacturing practices standards, PCA recommends that this regulatory action be withdrawn. Goal 3, T21, the policy that limits the sale of tobacco products to those over the age of 21, should be the basis for youth prevention and is an opportunity for CTP to work with retailers of tobacco products. CTP should provide further guidance on this congressionally adopted action. CTP's strategic plan should focus on regulations with clear congressional intent. The agency should collaborate with retail entities to develop guidance and best practices for point of sale verification and enforcement. The agency should refrain from using rhetoric promoted by anti-tobacco organizations that are not rooted in science and serve political objectives, which cast doubt on the agency's credibility and foster an adversarial relationship with industry. Goal 4, information campaigns and sponsored research should focus exclusively on risk reduction at the population level. CTP should openly discuss the continuum of risk relative to different tobacco products to provide consumers with informed choices about the level of risk they are willing to accept. Eliminate the use of hyperbolized language and overgeneralizations. When discussing risks, CTP should focus on data that represents typical use and avoid speculative statements intended to amplify potential risks. Concerns related to equity and health disparities should be addressed through information campaigns led by community-based organizations, not special regulations targeting subpopulations of consumers. Goal 5, CTP should openly acknowledge that the public risk at the population level is limited to a few types of tobacco products and focus its research and policy development and enforcement accordingly. CTP should embrace the congressional oversight and accountability and respond to inquiries, file mandated reports, and engage with members of Congress. CTP also has a wide open revolving door feeding leadership of billionaire-backed anti-tobacco organizations and big tobacco corporate interests. If high-ranking leadership at CTP continues to depart the agency for regulated industries within its purview or connected activist organizations, the center's judgment, strategy, effectiveness, and impartiality as a science-based regulator can be called into question. PCA thanks the Center for conducting this listening session.
Thank you for your comment. Up next is Willow Anderson. Please identify your organization or state whether you are speaking as an individual. You have 4 minutes for your comment. Please proceed. Is Willow Anderson available to make her comment? We'll proceed to the next commenter. Monita Sharma. Please come on the microphone and or video and state your organization, or if you're speaking as an individual. You will have 4 minutes to make your comment, and you may proceed. Is Monika Sharma available to make a comment? We'll proceed to the next commenter, Joe Murillo. Please come on the microphone and or video and state your organization, or if you're speaking as an individual. You'll have 4 minutes to make your comment, and you may proceed. Joe Murillo, are you available to make a comment?
Give us 1 moment, Joe is coming.
Hi, I'm Joe Murillo.
Please proceed.
Thank you. As I said, I'm Joe Murillo. I'm the Chief Regulatory Officer at Juul Labs, and thank you very much for the opportunity to speak here today. Juul Labs welcomes CTP's work to crystallize the strategic plan, which should incorporate the two tenets of the 2017 comprehensive plan. That is, to make combustible products less attractive and create a robust marketplace of less harmful alternatives for adult smokers who can't or won't quit. Unfortunately, the PMTA process has produced only 23 authorized tobacco-flavored e-cigarettes, representing only 4% of the tracked market. And now, shelves are flooded with illegal disposables, which data show are driving underage use. As CTP considers its new strategic plan, we urge the center to prioritize three key objectives. First, the application review process must become much more workable. Second, there must be a bolder approach to enforcement. Third, FDA should work toward communicating about the relative risk of products to help transition smokers away from combustibles. With respect to application review, the goal should be a well-regulated marketplace of science-backed alternatives, which serve as an off-ramp for adult smokers to switch. To achieve this, FDA should set forth clear rules and standards that facilitate clarity, transparency, and more consistent review of applications. We support the CTP's stated intention to enhance transparency of regulatory requirements and would note that in the past, we have found workshops that include dialogue between applicants and CTPs very useful. With most initial ENDS applications soon to be resolved, the center should return to its practice of iterative review and engagement with applicants throughout the application process to ensure against misunderstandings of the data. The current slow and inconsistent PMTA process also stifles innovation to create less harmful products. Those of us trying to comply with regulations are left with dated products by the time a decision is made, while those skirting the rules are marketing products without any participation in the regulatory system. We need a level playing field. It should not be easier to get a cigarette to market via the substantial equivalence pathway than a less harmful alternative. This prolongs cigarette use. Moreover, Section 910 requires FDA to issue an order in no event later than 180 days after the receipt of an application. There should be more accountability for meeting deadlines. On enforcement, we are very happy to see that youth use of Juul products has declined by 95% since its 2019 peak. But now illegally marketed disposable ends are the products with the highest youth use. These products pouring into the US from China have tripled since 2020, representing more than 40% of the ends market. We support CTP's efforts with respect to heightened enforcement, and we believe industry can play a useful role. We applaud the recent Center for Rapid Surveillance of Tobacco and are cautiously optimistic it will enhance FDA surveillance efforts. Lastly, FDA must communicate broadly to the public on nicotine and relative risk. As manufacturers, we are limited to the MRTP process, which many of us have engaged in. In addition, instead, trusted authoritative sources like this FDA are better messengers to make progress in addressing misperceptions. We are encouraged by CTP's recent statements on relative risk communications. We would also encourage CTP to bring together the medical community. Even just explaining product authorizations would help. Thank you very much.
Thank you for all of your thoughtful comments. We are going to take a break until 12 p.m. We look forward to hearing more comments when we reconvene at 12.
Hello, everyone. Welcome back to today's listening session about developing FDA CTP's strategic plan. We're ready to get back to our comments. Lauren Lempert, you are up next. Please share your organization, or if you are speaking as an individual, you have 4 minutes.
Hello, can you hear me now? Thank you for inviting me to speak. I'm a law and policy expert at UCSF T-Corps. Our T-Corps will be submitting written comments regarding CTP's strategic plan with many citations to the scientific literature supporting our recommendations. FDA asked what actions it could take in the next 5 years that would have the most impact in reducing tobacco-related death and disease. Today, I'll briefly focus on one action that CTP could take in the next 4 months that would meet its goals. We recommend that CTP finalize the product standards it proposed in April 2022 that would prohibit menthol in cigarettes and characterizing flavors in cigars, including menthol analogs. CTP promised it would finalize these standards by December 2023, and it should meet its self-imposed deadline. This is low-hanging fruit. The proposed product standards are based on valid scientific evidence, and finalizing them will have a huge impact in advancing health equity by significantly reducing tobacco-related harms, especially among youth, African Americans, and other priority populations. We submitted several public comments in June 2022 that provided significant scientific evidence demonstrating these health impacts. As we detail in our current and previously submitted written comments, it's important that the final menthol rules include menthol analogs, including WS3 and similar cooling agents that mimic menthol in tobacco products. It's well understood that the perception of taste relies not only on the sensory receptors on the tongue and in the nose, but also on the somatosensory system, which provides the mouthfeel of cooling or heating and is an integral contributor to flavor perception. All three systems, the gustatory, olfactory, and somatosensory systems, work together to create the perception of flavor. Synthetic cooling agents such as WS3 are odorless, but impart minty or cooling sensations similar to menthol. They're found in several so-called non-menthol products that are currently being marketed in California and Massachusetts, including, for example, Newport's non-menthols, Newport EXPs, and Camel Crisps. This marketing is trying to evade the statewide laws that prohibit selling tobacco products with characterizing flavors, defined in these states as a distinguishable taste or aroma other than tobacco. CTP's final rule should clarify that they are also intended to include products like these that include menthol analogs, such as WS3 and similar cooling agents that impart cooling sensations similar functionally to menthol, even if they don't smell like menthol. FDA's proposed product standards already include the foundation for such action, since they state that FDA considers the multisensory experience include not only taste and aroma, but also cooling sensations in the mouth or throat as relevant factors in determining whether a cigar has a characterizing flavor. This approach is based on sound science. FDA has all the scientific evidence necessary to finalize these rules by December 2023, and we urge CTP to do so. Every month of delay in implementing the proposed menthol standard would result in more than 29,000 new cigarette smokers and 1,300 deaths. These rules would significantly reduce tobacco-related death and disease, advance health equity, and minimize the likelihood that tobacco manufacturers will evade federal and state regulations designed to protect public health. Thank you.
Thank you for your comment. Willow Anderson, you are up next. Please state your organization or share that you're speaking as an individual. You will have 4 minutes for your comment.
Hello. There we go. Can you hear me?
Yes, we can
Wonderful.
hear
My
you.
name
Please
is
proceed.
Willow Anderson from the Public Health Law Center, which is a nonprofit organization that is focused on providing advancing equitable public health policies through the power of law. Thank you for the opportunity to comment on your proposed questions. First, we urge the FDA to center health equity in commercial tobacco product regulation by implementing policies that address the ongoing targeting of various communities by the tobacco industry and by prioritizing the health and well-being of all communities, particularly those that have been disproportionately impacted by tobacco use. The Public Health Law Center and its partners have been convening and drafting a citizen petition to this end, which will outline a proposed regulation in specific terms. But as it pertains to the FDA's strategic plan and the CTP's strategic plan now, we urge that health equities is centered in the public health standard. Next, community engagement like this and more opportunities for the CTP to actively engage with communities affected by commercial tobacco use to gather insights and understand local challenges. Third, resolving pending applications and incorporating a robust enforcement policy. Fourth, collaboration with states, including bilateral information sharing, will help leverage state resources and expertise to enhance the effectiveness of regulatory efforts. And to that end, we would also request that the CTP may request some funding from Congress to support collaboration with states. And as other commenters had suggested, the first things in the 2-year period that are absolutely attainable, and we would support the ongoing effort to finalize the menthol and cigar rules, but then further to adopt comprehensive flavor policies over the next 5 years. Included with that, nicotine reduction, and we would support that, as was already articulated in the strategic plan and initial comments by the new director. And then completing the review of pending applications and establishing robust enforcement in the marketplace. So those are some of the most important features, and we would appreciate the opportunity also to submit our comments in writing. Thank you.
Thank you for your comment. Our next commenter is Tom Eshelman. Can you please share your organization or that you are speaking as an individual? You have 4 minutes for your comments. Please proceed.
Hear me now?
Yes, we can hear you.
Hello. Thank you. My name is Tom Eshelman. I am commenting as an individual, but I work for a wholesale tobacco distributor, a small family-run business. And I would like to see some rules and regulations put forth that are simple for everybody to understand. The FDA needs to make clear-cut decisions so everybody knows what's going forward as far as everything. And I hear a lot of times people talk about that tobacco people are targeting people of color and LGBTQ, and I find that very incorrect. There's no ads that I've seen in many, many years that say that they target this. They talk about flavors. There's no more harm in a flavor than there is in a regular tobacco item, in my opinion. And also, no one ever talks about strawberry Trulies. If do you want your child out drinking an alcoholic beverage? I think there's more harm in that than there is in a tobacco item. There's many items that are adult only. We need to concentrate on having some more laws. When these underage people get caught with it, they seem they want to do is not do anything to the people that get caught with it if you're underage, so there's no penalty. I find that hard, and there's a lot of rules and regulations and tons of forms we have to fill out on the wholesale side. They need to simplify, make it uniform, keep all the laws, rules, and regulations consistent through all 50 states. It becomes very, very burdensome to monitor all this and stay in compliance, which we do. We work very hard at it. I think that people get their emotions more than science involved in this. There again, I don't use tobacco, but I'm speaking from a business standpoint and as an individual. And I just think that we need to get everybody on the same page, going down the same road so that we're all there. Nobody ever uses a UPC when they talk about what's a flavor, what's banned. And it's like opening up a bottle of wine. If we all open up a bottle of wine, all 4 of us are going to taste something different. You know, who's making the rules? I can't get clear-cut answers from people in government. Sometimes we get contradictory rules and regulations from different divisions. And we ask them who's right and who's wrong. We cannot get an answer. They say, talk to your attorney. But then that puts the burden back on us as a wholesaler to try and monitor this. And we've got to come together as a group and make this good for everybody. And we want to do what's right. We don't want underage children using any tobacco product. But I think we're using that, pulling on people's heartstrings when it's a legal product, is for adult consumption. I think we need to do is get the parents involved and do something with the children that are quote getting this. Why don't we stop it there, put some teeth in it on that end? There's some other things that we can do, but I think it's more administrative but we also have to not drag this out forever and a day on what's right or wrong. So the FDA's got to, get it figured out. If we have to do something, they give us till the 10th of the month to get it done. Why can't they get their stuff done so we all know what's going on? Come to talk to the wholesale community, ask us for input, ideas, how to do this, and we'd be more than happy to give good constructive help so that this doesn't happen. So thank you very much. I appreciate your time and the opportunity to testify today. And I don't think the menthol ban's the rule. I mean, the people will buy it. They'll buy it Canada. They'll buy it Mexico. They'll find other things to do, or they'll go back to regular tobacco. So is there any real harm in a menthol versus a regular cigarette? No. So that's my feelings on it. So thank you for listening today.
Thank you for your comment. Up next, we have Monita Sharma. Please state your organization or share if you are speaking as an individual. You will have 4 minutes for your comment.
Can you hear me?
Yes, we can hear you. Please proceed.
Good afternoon. My name is Monita Sharma, and I am an inhalation toxicology specialist at PETA. On behalf of my organization, I would like to thank the FDA's Center for Tobacco Products for the opportunity today to provide input for the development of the strategic plan. Multiple in silico and in vitro methods exist that can be used to conduct a robust toxicity analysis of tobacco products. Therefore, we encourage CTP to prioritize data only from non-animal methodologies to assess these products. No animals should suffer for the assessment of these voluntary use products that pose potential health risks that the consumers are already aware of. We encourage CTP to immediately release a policy to only accept in vitro data for MRTPs and PMTAs, and to include the revision of documents that request in vivo testing as a part of its strategic plan. These changes will better align with FDA's predictive toxicology roadmap and goal to improve predictivity while reducing animal use for the assessment of FDA-regulated product. Thank you so much.
Thank you for your comment. Up next, we have Siram Jabba. Please state your organization or share if you are speaking as an individual, and you will have 4 minutes for your comments.
Hello, can you hear me?
We can hear you. Please proceed.
Okay, thank you very much. Hello, everyone. Good afternoon. I'm Steier Jabba, a senior research scientist in Sven Erik Yacht Lab at Duke University School of Medicine, where I study the toxicological and addiction properties of flavor chemicals in tobacco products. I'm providing these comments as someone who has an extensive expertise in the field of tobacco regulatory science, including basic science research, menthol receptor pharmacology, toxicological research, regulatory policy, and advocacy. Also, I speak as a member of Yacht Lab that has conducted foundational studies on the effects of menthol on tobacco smoke inhalation and oral nicotine intake. Current ongoing studies in our lab focus on the behavioral effects of synthetic cooling agents that are mostly derived from menthol, and also on sweeteners and sweet-associated flavors. I'm also a member of the Yale Center for the Study of Tobacco Product Use and Addiction. More importantly, I provide these comments as a dad of 2 young children. We would like to thank the FDA for giving us this opportunity to comment. Specifically, we would like to bring attention to CTP for it to pursue regulations and guidance that would strengthen FDA's current flavor regulations by including menthol analogs, synthetic coolants, and sweeteners that are currently being added to a diversity of tobacco products. In this regard, we recommend that FDA's CTP as part of the strategic plan should define more precisely What should a characterizing flavor constitute in the context of a tobacco products regulatory framework? Odorless flavorants such as synthetic cooling agents that are devoid of a mint odor may not count as a characterizing flavors by definition. The concept of characterizing flavor is also not clear regarding the importance of the pharmacological actions of flavorants. For example, these synthetic cooling agents have similar pharmacological and cooling properties as menthol that are mediated by the menthol receptor. We have recently demonstrated that these synthetic cooling agents are being widely added in significant high amounts in several tobacco product categories, including e-cigarette products, smokeless tobacco products such as oral nicotine pouches. More worryingly, to evade the menthol ban in combustible cigarettes, tobacco industry introduced these odorless menthol derivatives in combustible cigarettes to provide the same cooling sensations provided by menthol, but without the characterizing menthol or minty odor. We have also demonstrated that these synthetic cooling agents containing tobacco products, such as nicotine pouch products and combustible cigarettes, can produce similar or stronger cooling sensations compared to that of menthol flavored tobacco products. Similar to these synthetic cooling agents, our research has also demonstrated that synthetic sweeteners such as ace-sulfame K, saccharins, sucralose were being added to diverse tobacco products, including snus, nicotine pouches, flavored cigars, and cigarillos. Rodent behavioral studies in our lab has also indicated that these synthetic sweeteners are added to potentially trigger intense sweet perceptions that would further mask the harshness of nicotine and tobacco. These synthetic sweeteners, like synthetic cooling agents, are odorless flavorants with strong pharmacological and sensory responses, and by current FDA definition will not count as characterizing flavors. Taken together, all these studies strongly suggest that the regulation of synthetic coolants and sweetener content may represent an efficient means to control appeal and palatability of a wide range of products and to reduce tobacco product use and initiations. More importantly, it maximizes the benefits of any proposed flavor restrictions. Finally, to further FDA's CTP proposed strategic goals and strategic plan that intends to maximize the public health benefits, advance health equity, minimize risks and health disparities, and have comprehensive efforts to address tobacco product appeal, we strongly recommend FDA to pursue regulations that would include odorless flavorants such as sweeteners, synthetic cooling agents, and also pharmacological and multisensory actions of these flavorants, including cooling sensation, into their regulatory framework and definition of characterizing flavors. Thank you very much for the opportunity, and we will submit the same as a written comment.
Thank you for your comment. Next, we will welcome Charles Giblin. Please state your organization or share that you're speaking as an individual. You'll have 4 minutes for your comment. Charles Giblin, are you available to make your comment?
I should be ready now. Yep. Okay,
we
good.
hear you. Please proceed.
Okay. Let me go back to my speech here. So anyway, good morning, everybody. My name is Charlie Giblin. I am representing the Center for the Advancement of Public Safety and Security. I'm the retired special agent in charge of the New Jersey Treasury Department. Of my 45 years in law enforcement, 36 were spent in the investigation and enforcement of cigarette and tobacco laws, including e-cigarettes or ENDS, overseeing the criminal, civil, and administrative aspects of these laws and programs, including writing legislation. I am not talking here to dispute potential health benefits or the methodology, but I am talking in regard to the FDA strategic plan concerning enforcement. My review indicates a complete lack of commitment to a viable and equitable enforcement program. You're poised to penalize legitimate regulated businesses instead of the criminal entrepreneurs who will be providing profits to transnational criminal actors. The special agents of your own Office of Criminal Investigation should not be diverted from their critical work protecting the integrity of pharmaceuticals and medical device industries here and around the world. The rush to repeat the disastrous prohibition of alcohol during the 20s and 30s will fail as quickly and as soundly as the best of intentioned policies. I have serious concerns with the FDA's proposed product standards, menthol and nicotine ban, and the negative impact these would have on the business community, revenue agencies, and law enforcement alike. No one has even suggested what the enforcement dynamic beyond the FDA special agents or how criminal enforcement will take place. What forensic testing to determine the product is even flavored, or what laboratory will conduct this testing? I'm truly concerned that you've not controlled vape or ENDS products that are making their way into our neighborhoods. And you're now proposing additional product categories to be banned. Our Customs and Border Protection is overwhelmed, protecting our nation from fentanyl. They should not be worrying about flavored tobacco. Instead, the FDA CTP should focus its strategic vision on harm reduction, solutions such as education, cessation support, and youth access prevention, all measures that would strengthen police-community relations instead of the opposite. It will not be the legitimate licensed manufacturers here in the United States that would distribute flavored tobacco in violation of your proposed ban, but the transnational criminal organizations were already partnered with the south of our border cartels. How will you enforce a business enterprise outside of your jurisdiction? Are you sending your agents over to the Chinese National Tobacco Company? I think not. Finally, you've not partnered with law enforcement leadership organizations such as the International Chiefs of Police, National Sheriff's Association, or the National Association of Law Enforcement Organizations for their input and cooperation. Spoken to the Federation of Tax Administrators. Again, putting the cart before the horse here when you can't even control the ENDS and vape products is a foolish and unwise decision. Thank you.
Thank you for your comment. Next, Kathy Facciano. Please state your organization or share if you are speaking as an individual. You will have 4 minutes for your comment. Kathy Facciano, are you available to make your comment?
Yes.
I can hear you. Please proceed.
My name is Kathy Fasciano, and I'm presenting on behalf of the Convenience Distribution Association, or CDA. CDA is the trade organization working on behalf of convenience products distributors in the United States. Its distributor members represent more than $102 billion in U.S. convenience product sales, serving a wide variety of small retail formats. CDA members operate in the legal, regulated, taxed, age-restricted, responsible channel. We recommend the following to address the CTP's questions. First, rescind the proposed rules, FDA tobacco product standard for menthol in cigarettes and FDA tobacco product standard for characterizing flavors in cigars. Removing the distribution and sale of these products from licensed, regulated, taxed, age-restricted distribution channels will push them into the illegal, unregulated, and untaxed illicit trade. Banning these products will undermine the public health by creating an unregulated market of untraceable and potentially adulterated products. Second, measurable short and long-term outcomes for the next 2 to 5 years. First, address the slowness of the pre-market tobacco applications, modified risk tobacco product, and substantial equivalency processes is a significant concern and should be made a top priority. Second, communicate the status of submitted PMTAs to ensure only those products with authorization are in the distribution pipeline. 3 specific actions CTP can take in the next 5 years. Expedite and complete PMTA processing of ENDS products and communicate results with industry and consumers, thus providing adult consumers with authorized legal products. Second, adopt a coherent harm reduction plan for bringing more order to the e-vapor market. This will require both accelerating authorization of products that deliver on harm reduction and enforcing the law to remove products that do not. Third, enforce current regulations, incorporating other appropriate federal agencies such as the FTC, DHS, CBP, and DOJ. This will not only significantly reduce currently available unauthorized products, but also address radio and print advertising of these products, as well as the movement of these products across the US border via ports, rail, and trucking routes. Other important initiatives include federal authorities must provide clear, actionable direction to wholesalers, retailers, consumers, and regulators regarding which products are authorized by FDA for sale and which are not. Second, federal authorities must leapfrog to the most powerful enforcement tools available for the most egregious and visible manufacturers and retailers who are knowingly making and selling illicit products. Third, federal authorities must address the discrepancy between the regulation of cartridge and non-cartridge e-vape products. In January 2020, the FDA announced a ban specifically on flavored cartridge e-cigarettes, excluding menthol only. However, a loophole has now been created as the market has shifted towards non-cartridge disposable vapor products and numerous youth-friendly flavors, the majority of which have entered into this country from other countries, leaving the compliant portion of the industry and consumers at risk. Finally, federal authorities must address online sales of unauthorized tobacco and e-vapor products. The power of the internet has provided consumers a pathway to purchasing unauthorized products without any oversight. These products can come from across the globe and are often unregulated, putting consumers of all ages at risk. We appreciate the recent opportunities that CDA has had to engage with the FDA. CDA stands ready to serve as a resource to answer any questions and provide feedback as you solidify your strategic goals. CDA urges the CTP to incorporate these items into a strategic plan. Thank you.
Thank you for your comment. Our next commenter is Sonia Wiggins-Pruitt. Please state your name, your organization, or share if you are speaking as an individual. You all have 4 minutes to make your comment.
Hello, can you hear me?
We can hear you. Please proceed.
Okay, great. Thank you for taking my remarks today. I am Sonia Pruitt, and I'm speaking as the founder of the Black Police Experience, and I'm providing comments specifically on the pending rules and regulations regarding tobacco product standards for menthol in cigarettes. I'm a former police captain with 28 years experience, a social advocate, and a professor of criminal justice. And I come from a family where close relatives were and are smokers. I do not smoke, and I do not condone smoking. I, however, fully support the right for consumers to choose to smoke a legal product. Carving out a subset of a legal product to be banned would be to create choice bias, but further, it would create opportunities for discrimination in those communities which favor menthol as a flavor for their cigarettes, and those communities are overwhelmingly Black and brown. Because I'm a retired police executive, I follow data. To date, there is no significant information that menthol increases disease risk or that it is actually associated with dependence among smokers. Even a Surgeon General report in 2020 indicated there was not enough evidence to support a menthol ban for smoking cessation. It is nicotine that is the addictive substance in all cigarettes, not menthol, and there is also no significant evidence that menthol eases the intake of cigarette smoke. It is a preference. If you remove the preference, smokers may simply pick a non-mentholated cigarette to smoke, and even worse, may buy menthol cigarettes from an illegal market, which will flourish. In addition, approaching social and health issues through prohibition has not worked in this country. One example is the failed prohibition of alcohol efforts in the early 1900s. Another example is understanding that while marijuana is increasingly being legalized, the criminalization of marijuana has historically led to the incarceration of millions of Black and brown people. Its use has not been approached as a health issue as opioids have been. I contend that cigarette usage should be approached with the same care, concern, and resources as opioid usage is now. While it has been said that a ban on menthol tobacco products are a regulatory issue which will not involve the police, I can tell you that saying that does not prevent an aggressive officer, whether well-meaning or not, from asking people about the cigarettes in their possession, especially since a ban will elevate an illegal underground market, which the police will have an obligation to investigate. Since menthol cigarettes are the preferred type in the Black community, this increases the opportunity for disparate interactions between the police and Black community members. We do not want any other incidents, such as the one that took Eric Garner's life, or that is leading to Black men being physically accosted by police on the boardwalk of Ocean City for something as benign as vaping. With an unregulated cigarette market comes other issues that place pressure on police, such as unregulated cigarettes, laced with dangerous substances such as fentanyl, cartels, gangs, organized crime, guns, illegal drugs, and human trafficking. Bans and prohibition are force multipliers for criminal activity. I, along with my colleagues who come from law enforcement and medical communities, and who are also anthropologists, sociologists, community leaders, and community members, are asking that the FDA and the Biden administration pause any movement on prohibiting menthol as a characterizing flavor in cigarettes until more studies be conducted around the societal impact this decision would have on our most vulnerable communities, until we have more education and cessation support be provided to smokers, more approval and accessibility for effective harm reduction products, robust enforcement of existing rules that regulate tobacco, especially amongst youth. And finally, we are asking for more opportunities for all stakeholders to be heard on this matter, especially from the communities that will be most adversely affected by such a ban. Thank you.
Thank you for your comment. Charles Gardner, you will be our next speaker. Please state your organization or share if you are speaking as an individual. You will have 4 minutes for your comment.
I will turn on my camera. And so thank you for listening to me. I'm speaking as an individual. My name is Dr. Charles Gardner. I'm a developmental neurobiologist by training. I held senior positions in the U.S. Department of Health and Human Services for 10 years, and I have served as a senior advisor to the World Health Organization for 3 years. And I have also taught healthcare ethics to medical students and nursing students at Howard University Medical School. My comments have to do with the healthcare ethics of your communications plan within the new strategy. Just for context, I'm going to draw upon numbers from the CDC's National Health Interview Survey for adults and National Youth Tobacco Survey for teens. The total number of American adults who are using tobacco or nicotine products is 46 million people. And the total number of teens who are using any of these products is 3 million teens. 100% of all of the deaths from any of these products is among adults. Almost all of that is 99% of it is adults over the age of 50, and 4 out of 5 of the deaths are adults over the age of 70. So it's older adults. That's from a public health perspective. That's the priority. That's what we need to try to address and to reduce. The other issue here is that probably 98% of those deaths are from one particular class of product, mass-produced combustible tobacco cigarettes. How you communicate the relative risk of all of those products, from premium cigars to nicotine pouches, to vape products, to the ones that are really causing the deaths, cigarettes, is obviously critical. And I am urging you from a healthcare ethics perspective to tell the truth about the relative risks, because you know what the truth is. Truth-telling is a fundamental moral principle in healthcare ethics. And over the past several years, your communications strategy has informed the public that vaping will literally cause worms to grow in your brain. Your communications activities have literally informed the public that vaping causes demonic possession. This is not truth-telling. And so I'm urging you, because you know there are relative risks, that you inform the people who are dying, smokers, and people who are using other toxic forms of tobacco, about those relative risks. And this is something that you have not done. Thank you.
Thank you for your comment. Our next commenter is Sami Hamdouche. Please identify yourself. Say if you are speaking on behalf of an organization or if you are speaking as an individual. You all have 4 minutes for your comment.
I'm Sammy Hamdouche, founder of Lucy, a small business making oral nicotine products. We support sensible regulation of tobacco products and believe such regulation should be designed to move consumers away from the most harmful forms of tobacco and down the continuum of risk. Regulation should also be calibrated to the realities of operating a small business and to harness the innovative potential of small companies. Crafting a 5-year strategic plan represents a pivotal moment in our industry, and we appreciate the chance to comment. Modern oral nicotine includes products like nicotine pouches and gums designed as satisfying alternatives to smoking. Despite being on the market for nearly a decade, modern oral products have very low underage use. However, CTP has yet to authorize any nicotine pouches or gums, and it's unclear how these PMTAs are being evaluated. CTP has given guidance that PMTAs for flavored ends, given concerns about youth uptake, would likely require a randomized controlled trial or longitudinal cohort study. But FDA has not expressed what concerns they may have in authorizing modern oral products and what data may address those concerns. This confuses stakeholders about whether an RCT or LCS may also be necessary for products with low youth uptake. This issue may be immaterial to big tobacco, who have the luxury of deploying cigarette profits to generate mountains of data, but for small companies, it's existential. The cost of running an RCT or LCS for a single SKU could bankrupt a small business. This is but one of the challenges we face as a small company trying to comply. The 2016 deeming rule articulates these challenges, stating that small entities, quote, may need additional time to comply with certain requirements of the statute, and that, quote, these activities may require an investment of employee time and or financial resources that is more challenging for the smallest entities to achieve. Small scale companies are singled out in the rule to, quote, ensure that entities with the most limited human and financial resources are uniquely considered in the FDA's decisions about enforcement of these provisions, precisely because they require resources not as readily available to these entities. In our experience, product sales are insufficient to meet the needs of small companies in this space, and raising outside investment is a must. But uncertainty around review criteria and timelines are anathema to investment, making it difficult for companies like ours to survive during the PMTA process, do any long-term planning crucial to operations, and continue innovating new products to meet the changing needs of consumers. We request FDA consider the following proposals. Given the low youth appeal and high public health potential, we ask FDA to devote resources to prioritize review of modern oral PMTAs. This would reduce regulatory uncertainty and allow small companies developing these products to thrive. Second, small companies should benefit from more open and frequent communication during the PMTA process to clarify questions that arise during review. In addition, small companies should have more time to respond to deficiency letters. 90 days is inadequate for companies without large regulatory departments who compete for limited lab capacity preferentially allotted to big tobacco clients. Finally, we propose holding public workshops to align on criteria for streamlined submissions. Streamlined PMTAs would allow small companies to focus resources on generating data that answers the most salient scientific questions while making more efficient use of FDA review resources. Small companies are vital to the goals of tobacco harm reduction. Historically, innovation in reduced risk products hasn't come from big tobacco, yet current policy tends to advantage companies that subsidize high compliance costs with their immense cigarette sales. The loss of companies like Lucy, whose success depends on innovation in reduced risk products, will undermine future progress. We feel the Tobacco Control Act has given FDA latitude in making rules flexible to the realities of operating a small business, and the deeming rule affirms the responsibility to do so. We urge FDA to consider proposals and look forward to working with FDA on our shared mission of moving consumers away from cigarettes. Thank you.
Thank you for your comment, and thank you to everyone for their thoughtful comments. As a reminder, this listening session is focused on the development of CTP's strategic plan and the goal-related information provided. Please provide comments on that relate to one of the 5 goal areas. Right now, we're going to take another short break until 1 p.m. Eastern. We will look forward to hearing more of your comments when we reconvene at 1. Thank you.
Is Ashley Roberts. Hello and welcome back. My name is Ashley Roberts from the FDA. We will begin this afternoon's session. As a reminder, this listening session is focused on the goal-related information provided in CTP's development of our strategic plan. Please provide comments that relate to one of the 5 goal areas. Up next, we have Will Jackson. Please state your name and organization or share that you are speaking as an individual. You have up to 4 minutes to comment. Please proceed.
Hey, can y'all hear me?
Yes, we can hear you.
Hey, I'm Will Jackson, president and sixth generation in family ownership of WL Petrie Wholesale Company located in Montgomery, Alabama. Our primary purpose of business is the wholesale distribution of products to convenience stores located through 6 southeastern states. We employ about 430 full-time team members, and these men and women help facilitate deliveries to 1,800 different convenience retail locations every week. For the year 2022, WL Petrie paid $47,713,287 in federal and state excise tax on menthol product alone. We are already fighting an uphill battle, which has been created by the perceived inability to enforce current vapor product laws. That perception is being validated by the FDA to some degree, and its acknowledgement that it cannot be everywhere. Proof of this is exhibited in the fact that over 97% of the vapor products on the market today lack FDA authorization. They're still being sold by many wholesalers and retailers across the country. The FDA, in my opinion, should focus on its approach and the expedited authorization of products that will help accomplish the goals of combustible cessation and work diligently with other agencies in the enforcement of non-authorized product. Furthermore, this rapidly growing illicit market with absolutely zero FDA oversight has the potential to be infinitely more harmful to public health than any of the menthol or tobacco products that are up for discussion today. Youth smoking is at its lowest level in an entire generation. This achievement can be attributed to the joint effort of the FDA and responsible tobacco manufacturers, wholesalers, and retailers. My question is, why penalize those of us who have worked so diligently to help enforce the laws, while at the same time allowing those illicit markets to openly manufacture, distribute, and sell products that do not consult with the FDA, do not care about the FDA's mission to protect public health, and frankly, only care about how to make as much profit as possible with no regard to the health of the public? The path forward is quite clear to me. Prohibition of any product that has as many consumers as menthol will inevitably lead to a black market that will capitalize on the opportunity available and put products into the hands of adult and youth consumers with little to no regard for laws or safety. By maintaining the current stance on harm reduction, emphasizing a scientific approach, expediting authorization, and putting more emphasis on working with all agencies to enhance enforcement, we can see the overall and youth usage number continue to decrease. There is no bigger challenge facing the FDA today than the need to bring regulatory coherence and support to the e-vapor market. The FDA's ability to manage this challenge effectively will truly influence the 2 to 5 year, as well as the long-term success rate of the FDA's tobacco regulation. By simply banning menthol and other tobacco items, the FDA will be creating a problem much larger than what exists today with the e-vapor alone. The ability to successfully regulate will be crippled, and the responsible manufacturers, wholesalers, and retailers will be damaged, in some cases irreparably. In closing, I would like to thank the FDA for the opportunity to speak and acknowledge as well as commend them for their most recent import alert and enforcement actions. This is an example of where our time, resources, and effort need to be focused, not on prohibition that frankly will never work. Rather than implementing a plan that will only continue to benefit illicit manufacturers, wholesalers, and retailers, the FDA has an opportunity to implement goals and plans that will help.
Thank you. Up next, we have Pamela Ling. Please state your name and organization or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Great. Can you hear me?
Yes, I can.
Thanks for allowing me to speak today. I'm Dr. Pamela Ling, professor of medicine at the University of California, San Francisco, and director of the Center for Tobacco Control Research and Education. I'm principal investigator of the UCSF Tobacco Center of Regulatory Science, which integrates biological, behavioral, and economic research to inform tobacco product regulation. I have over 20 years of experience in tobacco research with special interest in youth, young adults, and priority populations. The UCSF T-Cores will submit written public comments with feedback on the FDA CTP product strategic plan with citations supporting our recommendations. But today I'll briefly discuss two specific actions FDA can take now to enhance Goal 1 and one issue that should be added to CTP's 5 goals. First, FDA should follow through on the announced plan to develop a proposed rule by December 2023 that would establish a maximum nicotine level for cigarettes and certain other combusted tobacco products. The safest approach is a single-step reduction to less than 0.4 milligrams per gram tobacco applied to all combustible tobacco products. Implementing such a policy should dramatically and rapidly reduce disease and death from tobacco use. Second, CTP should immediately complete the process of updating its outdated list of harmful and potentially harmful constituents, or HPHCs, and commit to revisiting that every 3 years. FDA's 2012 list of 93 HPHCs is outdated and does not reflect the current range of tobacco products. The 2012 list focused on toxicants, primarily carcinogens found only in cigarettes. The 2019 proposed expansion would add many toxins found in e-cigarettes that may cause pulmonary or cardiovascular harms. Also, many oils and chemicals found in e-cigarette flavorants may be safe if ingested, but may cause other harms when inhaled. FDA received public comment in 2019 on the proposal to add 19 toxicants to the list, and it has had ample time to consider the 40 submitted comments, which were mostly supportive. CTP should finalize the updated HPHC list by December 2023 and begin using it for product assessments. Given the evolving tobacco product market, CTP's strategic plan should include updating HPHC lists at least every 3 years. Finally, in addition to the 5 proposed goals, CTP should actively integrate the relationship between cannabis and tobacco use into its tobacco regulation and prepare for regulation of cannabis. Tobacco and cannabis co-use is common, and as cigarette smoking rates are falling, cannabis use rates are increasing. Cannabis use and exposure to cannabis smoke are increasingly perceived as safe. However, the risks of co-use of tobacco and cannabis are greater than use of either product alone. Dual use results in a higher level of dependence to both nicotine and THC and is associated with a greater prevalence of mental illness. The tobacco and cannabis markets are co-evolving. For example, the popularity of nicotine vaping was accompanied by an increase in cannabis vaping products. And regulatory action eliminating flavored tobacco products opens market opportunities for cannabis products like flavored CBD vapes. Tobacco product regulations that can be readily applied to cannabis include prohibition of unsubstantiated health claims, limitations on advertising and packaging that appeal to youth, effective warning labels, prohibiting product formulations that increase health risks, prohibiting menthol and other flavors, and recognizing the need to prevent regulators and public employees from having conflicts of interest with the cannabis industry. As part of the strategic plan, CTP should identify best practices from tobacco regulation to support research and inform comprehensive regulations for cannabis. Thank you.
Thank you. Up next, we have Christopher Beaulier. Please state your name and organization or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
My name is Chris Beaulier, and I am the Director of Retail Operations for Cigarette Shopper. We operate 21 tobacco-only stores across the state of Maine. Today, my comments will focus on goal number 1 regarding comprehensive tobacco regulations and guidance, and goal number 3 regarding compliance and enforcement. When the FDA requested comments from retailers in response to the proposed regulations to ban menthol cigarettes and flavored cigars, retailers submitted tens of thousands of comments about the impact of such prohibitory regulations and the very real likelihood of an illicit market to supply the continued demand for these flavored products. However, in the proposed menthol cigarette and flavored cigar product standard regulations, the FDA claimed that the effects of an illicit market would be minimal. This country already has a large illicit cigarette market, primarily caused by high excise taxes. The Institute of Medicine estimates that between 8.5% to 21% of the current cigarette market consists of smuggled cigarettes. Also in 2015, the federal government issued a report titled "The Global Illicit Trade in Tobacco, a Threat to National Security." The report concluded that consumers, retail outlets, manufacturers, and governments are all harmed by the illicit trade in tobacco products. The FDA's new strategic plan needs to give serious consideration to how the agency will respond to a broad illicit market if more tobacco products are banned. Why? Because a widespread illicit market will undermine the health-related goals, since illegal sellers will continue to sell banned products to anyone of any age who has cash. With some 22 million adults who buy menthol cigarettes and flavored cigars, this sheer number of adult consumers will continue to demand these tobacco products, and the illicit marketplace will seize the opportunity to meet that demand. The agency cannot minimize the likelihood of and scope of an illicit market. Regarding enforcement under goal number 3, recently the FDA began compliance blitzes on randomly selected retailers to determine if these retailers are selling particular unauthorized electronic cigarettes and vapor products. However, since these blitz efforts are localized and limited in the number of retailers inspected, enforcement is not nationwide nor all-encompassing, since every retailer is not inspected. We acknowledge that the FDA's enforcement resources are limited and that a compliance check on every retailer in the country in a defined period of time is not even possible. However, this results in unequal enforcement and a real sense among retailers that some stores will continue to sell unlawful products, and those stores that are the subject of an inspection will not. In other words, some stores will have a competitive advantage over others when all retailers should be operating in the same manner and under the same rules. The strategic plan needs to include action so that every retailer complies with the law at the same time to avoid a patchwork of pockets of enforcement. This could include clear and concise ongoing announcements to retailers and retail trade associations about what products are lawful and not lawful to sell. It is through clear communication and ongoing education that retailers will understand what products they can and cannot sell. In addition, the FDA needs to include in its strategic plan a means to conduct nationwide compliance checks on every retailer to send a clear message that all retailers need to comply with the law. Thank you for the opportunity to participate in this listening session.
Thank you. Up next, we have Vijay Mayor. Please state your name and organization or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Good morning or good afternoon. My name is Vijay Mayor, and I represent the Northeast Wholesalers Association and the Southern Association of Wholesale Distributors. Both organizations work on behalf of convenience products distributors in their respective regions. Our members represent more than half of the $100 billion convenience product sales, serving a wide variety of small retail formats. Convenience distributors directly employ nearly 59,000 people and support over 173,000 jobs annually. The convenience distribution sector contributes billions in economic and fiscal activity in the U.S., including $2.3 billion in tax revenue and $30 billion in tax excise taxes. As the FDA's Center for Tobacco Products develops its strategic plan, we recommend the following to address CTP's questions. The FDA should rescind its proposed rules, FDA Tobacco Product Standard for menthol and cigarettes, and FDA Tobacco Product Standard for characterizing flavors in cigars. Removing the distribution and sale of these products from licensed, regulated, taxed, age-restricted distribution channels will push them to illegal, unregulated, untaxed illicit trade. Banning these products will undermine the public health by creating an unregulated market of untraceable and potentially adulterated products. A 2015 report from 5 federal agencies outlines the issues already present in illicit trade. A ban on menthol will send these products to this market, further exacerbating the challenges to national security created by illicit trade. Left unchecked, these growing illegal operations solidify into a corrosive mixture of crime, corruption, and circumvention of the nation's tobacco control laws, putting at risk efforts to keep tobacco out of the hands of young people, disrupting legal commerce and putting honest businesses at a disadvantage. Regarding measurables, short and long-term outcomes for the goals, A, addressing the slowness of the pre-market tobacco applications, modified risk tobacco product, and substantial equivalency processes is a significant concern and should be made a top priority. FDA's slow enforcement led to the emergence of an illicit market of disposable flavored ends products, awash in unauthorized, unregulated, untaxed products that are being manufactured, sold, marketed outside of the system. Many of these unauthorized products are made by companies who have no intention of ever filing a PMTA, being sold through illicit channels and creating unfair competitive conditions that put legitimate wholesalers, such as my members, at a significant disadvantage. PTP should expedite and complete the processing of ends products currently in the PMTA pipeline. B, communicate the status of submitted PMTAs. There's currently no way for distributors to know the status of a product's PMTA. There must be transparency and communication, not only for manufacturers submitting the application, but for the distributors distributing a product in order to ensure only those products with authorization are in the pipeline. Regarding the question, what are 3 specific actions CTP could take in the next 5 years? A, expedite and complete PMTA processing of ends products and communicate results with industry and consumers, thus providing adult consumers with authorized legal products. B, adopt a coherent harm reduction plan for bringing more order to the e-vapor market. C, enforce current regulations incorporating other appropriate federal agencies. This will not only significantly reduce currently available unauthorized products, but also address radio and print advertising of these products. 4, regarding the question, are there any important features, activities, or initiatives not encapsulated that we'd like included? A, federal authorities must provide clear, actionable direction to wholesalers, retailers, consumers, and regulators regarding which products are authorized by FDA and which are not. B, federal authorities must leapfrog to the most powerful enforcement tools available for the most egregious and visible manufacturers and retailers who are knowingly making and selling illicit products. C, federal authorities must address the discrepancy between the regulation of cartridge and non-cartridge e-vape products. D, federal authorities must address online sales of unauthorized tobacco and e-vapor products. These online sales detrimentally impact domestic industry players who are heavily regulated by the government. I thank you for your time and look forward to working with you in the future.
Thank you. Up next, we have Peter Kruger. Please state your name and organization or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Good morning. I'm Peter Kruger with the Nevada Petroleum Marketers Convenience Store Association. We are a statewide trade group that represents Nevada convenience store owners, liquid fuel distributors, and retailers and transporters. Our mission is quite simple: to advance the role of our members as positive contributors to the economic, social, and philanthropic well-being of the communities they serve. Convenience stores and fuel distributors are critical components to Nevada's economy, with stations and stores in every one of our 17 counties. Nevada has more than 1,200 convenience stores and employs more than 18,000 employees with annual gross sales of more than $4.7 billion. On behalf of my members, I want to provide a small business perspective on the CTP's 5-year strategic plan. First, as the FDA and CTP develops its strategic plan, our members urge FDA to rescind its proposed ban on the sale of menthol cigarettes and characterizing flavors in cigars. In 2020, during an FDA listening session of these proposed rules, I spoke about how tobacco retailers are the first line of defense in preventing underage sales, and I remain proud, and as well our members, of our ongoing efforts. A well-regulated market with responsible retailers in Nevada and across the nation are key in reducing underage tobacco use. According to the National Survey of Drug Use and Health, youth cigarette smoking is at a generational low of 1.3%. The rate is even lower for menthol cigarettes and cigars at 0.8%, also the lowest in a generation. And use of premium cigars is 0.1%. Second, over the next 2 to 5 years, we urge CTP should manage short-term and long-term outcomes if its proposed goal areas for prioritizing pre-market tobacco applications, modified risk tobacco products, and substantially equivalent processes. Increasing the transparency and speed of these processes will enable the retailers to partner with CPT to help ensure that only authorized products are sold in a regulated market. We believe the FDA has been slow in these processes, which is, at least in Nevada, led to the emergence of an illicit market of disposable flavor electronic nicotine delivery systems, or ENDS products. Many of these unauthorized, unregulated, and untaxed products are being manufactured and sold by companies who operate outside the regulated system and have no intention of ever filing a PMTA. CPT should expedite and complete the process of ENDS PMTAs that are currently in the pipeline. CPT should also use a published list of categories and brands of ENDS and other deemed products with delivery derived from nicotine that have been filed timely PMTAs with details about where each of these each of the applications are. Publishing a list will protect the public health by diminishing the availability of illicit products in the marketplace. Our members are strongly in favor of getting this directory out as soon as possible. This process will enable responsible retailers, my members, to manage our inventory and business operation. A published list would also better.
Thank you. Up next, we have Doug Ball. Please state your name and organization, or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Convenience stores in the Western U.S. At Jackson's, we take our responsibility of keeping age-restricted items out of the hands of youth members very seriously and are proud of the work we, along with other responsible retailers, have done to help drive youth cigarette usage rates down over the past number of years. The National Survey on Drug Use and Health 2002 to 2020 combined shows a decline in youth cigarette usage by 90%. In 2002, 13% of 12 to 17-year-olds reported smoking a cigarette in the past 30 days. In 2020, that number had dropped to 1.3%. That decline can't happen without responsible retailers doing their part to limit access to youth. As you set the direction for the next 5 years, I urge the FDA to withdraw its proposed rules to ban the sale of menthol in cigarettes and characterizing flavors in cigars. This proposal is just another prohibition-based policy that has proven to be ineffective over the years. A menthol ban would push consumers to seek out their preferred menthol cigarettes from the illicit market. Prohibition policies have proven this time and time again. When consumers turn to the illicit market, IDs are not checked to age verify, potentially dangerous products not regulated by the FDA are sold, and local, state, and federal taxes go unpaid. Adult tobacco consumers have been unfairly targeted as a group over the past couple of decades. Local, state, and proposed federal bans on flavored tobacco products have taken away the choice for many adult tobacco consumers under the guise that the bans are to keep these products out of the hands of our youth. While tobacco consumers are routinely targeted, adult alcohol consumers continue to see the proliferation in choices, many which seem to be attractive to youth. Mountain Dew, Sunny D, and Monster Energy all offer alcoholic versions of their beverages today. These brands appeal to youth way more than a menthol additive in a cigarette. On top of that, these products are on the sales floor where youth have access to them. All tobacco products are located behind the front counter, and a sales associate will only hand the tobacco item to the customer after their age has been verified. The FDA's estimates on menthol smoker behavior if a menthol ban is enacted comes from a single study that is fundamentally flawed. In 2021, David T. Levy conducted an expert elicitation on the effects of a ban on menthol cigarettes and cigars in the United States. This study, funded by the FDA, asked 11 experts that were chosen by the authors about their opinions on how menthol smokers might behave under a menthol ban. The experts assigned percentages to potential behaviors like quitting or purchasing menthol cigarettes from the illicit market. There was no actual consumer data used from current flavor ban markets in the US or abroad to come up with the study's conclusions. To highlight the disparity between the expert opinions, when asked what percentage of menthol smokers would initiate with a non-menthol cigarette in the presence of a menthol ban, one expert estimated 79%, while another expert estimated 1.9%. The authors of the study averaged all the responses and arrived at a mean of 30.3% on that question. With $29 billion in annual retail sales at stake, the FDA needs to do more actual scientific research to behaviors instead of relying on the opinions of 11 individuals. Studies done using actual consumer behavior in flavor ban markets show that a large percentage of menthol smokers will continue to seek out and find menthol cigarettes in the illicit market, and the illicit market will grow exponentially. Cigarette excise taxes, sales taxes, and settlement payments make up more than 50 cents on the dollar spent on every pack of cigarettes. In the first year after the potential flavor ban, it's been estimated that the total lost tax revenue would be $8.9 billion. Over 10 years, it's estimated that would be $79 billion. I would like to remind the FDA that responsible retailers like us have been instrumental in helping drive underage usage of tobacco products to historic lows. Please continue to build on the progress with the regulated market and work with responsible retailers to continue to make progress. I urge you to choose harm reduction policies over prohibition. Thank you for your consideration.
Thank you. Up next, we have Jeffrey Smith. Please state your name and organization, or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Thanks, Ashley. And a special thank you to the ASL interpreters. You guys have done a wonderful job today. My name is Jeff Smith, and I'm a senior fellow in the Integrated Harm Reduction team at the R Street Institute. R Street is a nonprofit, nonpartisan public policy organization focusing on advancing limited, effective government in various areas, including tobacco harm reduction. We would like to commend the Center for Tobacco Products on initializing its institutional assessment process and thank the center for the opportunity to provide comments today. As a former university professor, I have been involved in assessment programs at many levels, from individuals to institutional. By far, the most important step in creating a successful assessment program is clearly defining your mission statement and building your objectives and strategies with the mission statement at the forefront. For many years, the center has stated that appropriate for the protection of public health was their North Star. Consumers, manufacturers, and policy advocates have yet to understand what this mission statement means based on the actions of the CTP. In its short history, we have seen hundreds of brands of combustible products protected within the marketplace and only a handful of reduced risk products receiving MGOs. How do these actions align with the APPH? A successful assessment program with achievable outcomes requires that the APPH mission statement be clearly defined, articulated broadly, and that all actions of the center are focused to meet the defined objectives that are drawn from it. Based on the experience thus far, the center seems to be only acting on protecting the health of youth, not the entire population, more specifically, adult smokers. So expanding that definition should be the priority for the CTP. Additionally, the way the center processes are communicated with audiences, specifically manufacturers and consumers, should be improved. The PMTA pathway for novel reduced risk products continues to be unclear and impossible to successfully navigate by any manufacturer other than the largest tobacco companies. When the guidance was first published, it was understandable that many aspects of the requirements were unclear. There was a myriad of new products, gaps in the science, and a lack of understanding around how consumers would use the novel products. This all led to the responsibility falling on the applicant to assume what research studies, methods, and endpoints might meet the APPH standard. However, the center has now granted marketing orders for several reduced risk products, albeit too few, to allow for all manufacturers, including small and mid-sized companies, to compete fairly in the marketplace. The CTP must update the PMTA guidelines to include specifics around research studies, product standards and requirements so that manufacturers with limited resources are not forced out of the marketplace due to their limited budgets for exploratory and potentially unnecessary research. Ideally, the applicant would only be required to submit evidence required to meet initial product safety standards defined by the center. Additional post-market surveillance monitoring would allow for clarity around unforeseen risks and the product's overall impact on consumer health. The CTP must also better educate the whole of the public as to how reduced risk products are a pathway to better health as compared to combustible tobacco. The confusion generated by the CTP and its messages led consumers to believe that reduced risk products are as harmful as traditional combustible cigarettes, which is not accurate. Future messaging produced by the center should be focused on reducing the burden of harm for all consumers, including those that choose to continue to use nicotine. This is the only path forward for the center. If the center intends to significantly reduce the number of lives lost due to smoking-related diseases in our country. We believe these major items should take priority and will help steer the CTP in a sustainable direction. We appreciate the center's willingness to hear us today. We want to reiterate that the fewer people smoking, the better. We believe, however, that harm reduction is an effective off-ramp to cigarette consumption and better mitigates the negative consequences that can arise regulating human behaviors. Thanks.
Thank you. Up next, we have Meredith Berkman. Please state your name and organization or share that you're speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Thank you so much. My name is Meredith Berkman, and I'm a co-founder of Parents Against Vaping E-Cigarettes, an organization founded by 3 moms in 2018 as a grassroots response to the youth vaping epidemic. Over the last 5 years, our education and advocacy nonprofit has become the first and only national parent voice fighting youth tobacco use and the predatory behavior of the tobacco industry. And I am truly grateful for the opportunity to address you today. Our organization represents the millions of parents across this country whose families' lives have been upended by an ongoing public health crisis that not only impacts our children, but also, as the CDC recently reported, impacts 10% of young adults between the ages of 18 and 24. This is not a problem that is going away. In fact, we urge CTP, along with its sister agencies, to focus on cessation for young people addicted to nicotine through their dependence on e-cigarettes. Parents like us are desperate for resources, treatments, any help they can get to help their kids conquer severe nicotine addiction and mitigate negative health consequences. There has not been a public hearing at CTP on this topic since January 18th, 2019. It was called Eliminating Youth Use of Electronic Cigarettes and Other Tobacco Product Use, the Role for Drug Therapies. We are very grateful to CTP for its willingness to engage with stakeholders like us, and we hope there will be many more public opportunities for CTP to hear what is actually happening on the ground. The industry is extremely nimble and shapeshifts very quickly with new products, and again, we hope there will be more opportunities to hear from the public and specifically from impacted groups, the so-called boots on the ground. We all know what happened. Juul opened a public health Pandora's box and created the youth vaping epidemic using enormous amounts of nicotine, flavored products and targeted social media to lure teens. The agency's repeated delays and failures to comply with a federal court-ordered PMTA deadline and failure to close regulatory loopholes in a timely fashion have allowed many thousands of bad actor companies to follow Juul's example with devastating consequences for our kids. Now, looking forward, both CTP Director Dr. Brian King and FDA Commissioner Dr. Robert Califf have publicly stated this process will finally end at the end of December 2023, and we take them at their words. And we want to look forward, not backwards, because the damage is done. But what we do want to urge is that CTP leadership focus on enforcement. Immediate, forceful, and final enforcement that takes every single unauthorized product, the majority of them flavored, and which will be easily accessible to kids off the market. With all due respect, we do not think that warning letters are doing the work that they must. If you look deep into the bowels of many of the websites that say they are no longer selling flavored nicotine products, but nicotine-free, you will find that the flavored illegal nicotine products are still for sale. Again, we also want to urge CTP to be transparent in its communication of its enforcement. We repeatedly call after these letters are released and ask if, in fact, 15 working days later, have they received a response? And we're told that they cannot comment on an ongoing investigation. If that were true, then why would these letters be released in the first place? Again, I want to thank you for this opportunity, urge you to enforce immediately, to take all these many millions of illegal flavors off the market to protect our kids and to keep this generation becoming one of nicotine addicts. Thank you.
Thank you. Up next, we have Lyle Beckwith. Please state your name and organization or share that you are speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Hello, can you hear me?
Yes, we can.
Great. My name is Lyle Beckwith. I'm the Senior Vice President of Government Relations for the National Association of Convenience Stores in Alexandria, Virginia. I've also been on the board of directors of We Card Coalition since its inception 28 years ago. You've all seen the We Card logos, signs, the yellow under 21 no tobacco. We are the preeminent trainer of retailers as to how to identify and not make underage sales. I actually had a prepared statement, but I threw it away a few minutes ago as I was listening to the comments coming in from many of the trade association and retailers. And I was basically going to make some of the same comments. So what I want to do instead is just take my time to use just a few of the data points that we have here at our association to drive some of those points home. And it really revolves around the comments about the proposal to ban menthol and flavored cigarettes. I'm sorry, something just popped up on the screen here. Clearly, the issue for us is that there is an established market in menthol right now. 37% of tobacco sales are menthol. And those sales will not go away. That demand is not going to go away with a ban. As others have said, it will create an illicit market. Right now, I'm sure there are Chinese manufacturers and organized crime and street hustlers who are just wetting their lips at the opportunity to get into this space, this void filled by a potential ban on menthol. And what I mean by that is just for the convenience store industry, that doesn't take into account supermarkets or vape shops or tobacco shops, but just the convenience store industry alone, there was almost $42 billion in tobacco sales in 2022. Of that, 19.2 billion was in menthol. So a $19.2 billion just from convenience stores market is very attractive to an illicit market. But more importantly, because of the tax rates, our industry collected and remitted $22.54 billion to state and federal governments last year, of which 8.34 billion was in menthol tax on menthol products. We use every state has different tax rates, but we use a rounded method. Say the average is 43.5% tax on a pack of cigarettes, be it menthol or regular. So what does that mean? To the illicit market, that immediately means that you've got a 50% reduction in price coming out of the box. You're not paying taxes. You're not checking ID, as other people have mentioned. You're selling other products beyond menthol cigarettes. So every time that there has been a proposal to raise cigarette taxes, the argument has been given the best way to get people to quit is to raise the price. Well, what is the inverse of that? If you're cutting the price in half and selling them out on the street and you don't know what's in them and no one's checking ID, what kind of market is that going to create? And we've already heard about the problems of enforcement. Who's going to enforce? I mean, we're having problems enforcing getting illegal products off the market now. Who's going to enforce all the illicit market of menthol? That's going to surely erupt if this comes through. Thank you for your time, and I appreciate the opportunity.
Thank you. Up next, we have Michael Schoenfeld. Please state your name and organization, or share that you're speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Can you hear me?
Yes, I can.
Okay. Good afternoon. First of all, I would like to thank you all very much for including me in today's conversation. Hang on a second. My name is Michael Schoenfeld, and I'm one of the family owners of MTC. We have a 3-generation wholesale distributor located in Manchester, Connecticut. We sell cigarettes, tobacco, non-flavored vape, and other miscellaneous C-store items. My grandfather started the company in 1942 with $200 in his pocket and a high school diploma. We currently are one of the largest local Connecticut distributors, servicing mainly independent mom and pop convenience stores, package stores, and gas stations. On the surface, I understand what the federal government is trying to do, but my opposition and concern is of a menthol cigarette and a flavor cigar ban, which is derived from the lack of ability for the federal government to enforce and implement the laws, as well as communicate to businesses what products are legal and illegal. Currently, the industry faces large illegal trade in all aspects of cigarettes, tobacco, and vape. Products from the black web, overseas shipments from questionable countries, and counterfeit products exist within the market. Every single day, I personally receive at least one email or phone call from some random company that wants me to distribute their product that I know have not even applied for a PMTA, never mind receive a PMTA approval. The companies that comply with existing laws lose, and those that do not win. As a local business, I interact with my retail customers closely. I see firsthand now that the counterfeit and untaxed illegal products flow into the marketplace. A prime example of this are 4 stores located adjacent to each other in the Hartford, Connecticut area. One store started selling illegal cigarettes and vape. When the other 3 stores complained to the state, there was little resources to help stop the one bad apple from continuing its illegal ways. The retail customer is now faced with either selling the illegal product like his neighbor or going out of business. Should his conscience be his guide, or his family lose their income? So many stores choose to buy the illegal products, causing my sales as an honest and ethical wholesaler, as well as a manufacturer, to diminish. If the situation is not truly being adequately addressed successfully on a state or federal level currently, then how do you implement it to the scale of 7 million more products? The only solution I can extrapolate from is making sure there are strong, enforceable, unified rules between the federal government and every single state. There needs to be thousands of government enforcement employees to carry out these rules. There needs to be structure and consistent guidelines with high penalties for those who do not comply. There needs to be clarity from a federal list that businesses can utilize to make sure they do not sell inappropriate products. Even if one state is lackadaisical, the system will crumble because those who wish to exploit it will use that specific state as a loophole opening. Timely action is also a huge concern. If it takes years to stop the illegal activity, there will be no legitimate companies left to even deal with this. So as the process of PMTA's acceptances or denials comes to an end and the potential of a menthol ban looms, MTC plans on adhering and honoring these rules. As a true tax-paying businessman, I understand the FDA is here to watch over its citizens from potentially harmful products. It is my assumption that manufacturers like Altria, PMI, RJR, ITG, legitimate wholesalers like myself, reputable chains, and even most importantly, retailers throughout the country will follow the rules. The issue is not with individuals engaging currently on this very Zoom call. It's the ones that aren't participating. Thank you very much for your time.
Thank you. Up next, we have Giles Ship. Please state your name and organization, or share that you're speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
Okay, can you hear me?
Yes, we can.
Yes, all right, thank you. My name is Giles Ship. I am here today representing NOBLE, which is an acronym for the National Organization of Black Law Enforcement Executives. I have over 34 years in the field of law enforcement. I'm a former director of a police department in an urban center in New Jersey. I have been as I said, a past national president of Noble, which services over 3,500 chiefs of police, commissioners, as well as sheriffs and other law enforcement executives from federal, state, and county and municipal law enforcement agencies. One of the things that I wanted to also mention is that I don't know how much research has been done in this area, but we suggest that there be more studies. There more studies needed to be done to include law enforcement executives. Also, there are already laws in place to address all of the concerns that I've heard so far about this issue. But let me just say to you that menthol cigarettes, which currently make up around a third of the cigarette market, are disproportionately used by Black Americans. While proponents of the ban claim that a menthol ban prohibition is a matter of racial justice, the reality is that such a ban will most likely contribute to overcriminalization in Black communities already struggling to determine the role that policing should play in their neighborhoods. That is why the National Organization of Black Law Enforcement Executives, better known as NOBLE, has taken a strong stance on the issue, stating that such a ban will trigger criminal penalties, which will disproportionately impact people of color, as well as prioritize criminalization over public health and harm reduction. We know that there's no disparity in the harm from a menthol versus a non-menthol cigarette. They are both equally harmful to all communities. Therefore, to address this issue in a singular way would only further strain police and community relations. While organizations like Noble work in communities across the nation, trying to bridge the gap between community and police. We have 55 chapters throughout the United States and the Caribbean and the UK. And we strongly suggest that, and this is from our practical experience as law enforcement officials and our research, we know what does not work as it relates to addictions, using a criminal justice model to address a medical problem. What does work is education, treatment, and counseling, which is a medical model. Let's follow the science. Using a punitive process to address a medical problem, frankly, does not work. Examples are prohibition of alcohol and the war on drugs. We have learned over the years, especially with the war on drugs, is that it destabilizes community and erodes trust in law enforcement. Over the last approximately 25 years, smoking has declined by approximately 40 to 60%, depending upon which community, and it has the largest dip in the African-American community. This was due to education, treatment, and counseling. Again, I respectfully request that we follow the science and keep neighborhoods safe versus creating another underground economy that will result in more destruction and widen the gap between communities and police. Please feel free to contact me for further testimony, and thank you for this opportunity.
Thank you. Up next, we have Thomas Bryant. Please state your name and organization, or share that you're speaking as an individual. You have up to 4 minutes for your comment. Please proceed.
I am the Executive Director of the National Association of Tobacco Outlets, a national retail trade association with 66,000 member stores nationwide. I'll be focusing my comments on goal number 3, ensuring compliance of regulated industry and tobacco products, utilizing all available tools, including robust enforcement actions. Specifically, my comments will be on enforcement related to electronic cigarettes and vapor products. We want to clearly affirm our strong support for a well-functioning federal regulatory system and strategic plan in which FDA oversight leads to accelerated reductions in underage use and in tobacco-related harm. All the progress made in recent years has occurred within a legal, regulated system in which tobacco products are made, distributed, and sold by retailers committed to FDA oversight. But central to the long-term efficacy of any regulated market is the rule of law, good behavior being encouraged and bad behavior being punished. However, other manufacturers and sellers have rapidly emerged and took a completely different path in the absence of a strategic plan of enforcement. They have flooded the market with thousands of new disposable e-vapor products with every flavor manageable. As a part of a new strategic plan, the FDA should consider communicating that it will prioritize enforcement against products that entered the market after 2016 in violation of the 2016 final deeming rule. Also, if it prioritize enforcement for those companies that failed to file PMTA applications in violation of the 2020 guidance issued by the FDA, or to companies that disregarded any other of the rules FDA has established since 2016. To help the retail trade align their conduct with these priorities, the FDA's new strategic plan can and should provide a complete list of product SKUs with properly pending PMTA applications under review since 2020, and an ongoing list of products which have received refused to accept letters, refused to file letters, and marketing denial orders. Only with such a list would retailers be able to adequately and properly comply with the law. With these actions, in conjunction with the extensive state inspection infrastructure, the FDA can focus on the presence of non-compliant products in a comprehensive way and begin to drive unlawful products out of the market. Companies not complying with FDA regulations must be held accountable, and we believe that the FDA's strategic plan should require that the agency employ its most powerful enforcement tools on those offenders. These actions would include the following under the strategic plan. First, issuing cease and desist letters immediately to all, not just some, of the offending entities. Second, imposing maximum and ongoing civil money penalties on all of the offending entities. Third, bringing injunction lawsuits against the major offending manufacturers and major distributors. And finally, commencing criminal investigations focused on the most egregious actors. Thank you. That concludes my comments. We appreciate the opportunity to present today.
Thank you. Up next, we have Chris Howard. Please state your name and organization, or share that you're speaking as an individual. You have up to 4 minutes for your comment. Please proceed. Chris Howard, are you there? Please proceed. Chris Howard, can you hear us?
Yes, I can hear.
There you go. We can hear you now.
Great, thank you. If you're ready, I am Chris Howard. I'm a member of the Coalition of Manufacturers of Smoking Alternatives, or CMSA. CMSA is a trade coalition group representing responsible manufacturers of smoking alternatives committed to regulatory compliance and a level playing field for compliant members of industry. CMSA members focus on products that are considered potentially reduced risk on the tobacco nicotine risk continuum, such as modern oral white pouch products and electronic nicotine delivery system products. Our association is encouraged that CTP is embracing the identified need to develop a predictable, consistent 5-year strategic plan, and thanks Director King and the center staff for their work to implement the Reagan-Udall Foundation recommendations, and of course for providing this opportunity to comment. CMSA's comments will focus on 2 areas that CTP should consider as part of its strategic plan, with a specific emphasis on how other FDA centers have approached these objectives. The first area I'll address is key features, activities, or initiatives, measurable short and long-term outcomes, and specific actions. Critically, in defining and carrying out strategic priorities, other FDA centers have established clarity about their desired end state and specific quantifiable targets toward reaching that end. I'll provide 2 examples. Number 1, the Center for Drug Evaluation and Research strategic plan sets goals in relation to 3 long-term objectives to implement FDA's statutory responsibilities. Currently, Because long-term goals are unclear, CTP's mission appears disjointed in relation to its statutory and regulatory oversight obligations. For example, one stated purpose and obviously a long-term objective of the Tobacco Control Act is to ensure that there's effective oversight of the tobacco industry's efforts to develop, introduce, and promote less harmful products. CTP's current plan does not appear to prioritize this. Rather, since 2019 and continuing today, this effort to promote less harmful tobacco products has taken a backseat to other concerns. Example number 2, goals must be broken down into actionable tasks with measurable targets. The Center for Devices and Radiological Health set the strategic priority of partnering with patients to increase the use and transparency of patient input in decision-making, and then set a target to include a public summary of available and relevant patient perspective data considered for their pre-market applications by a set date. CTP should employ a similar approach to goal setting to ensure its goals are actionable and impactful. For example, by establishing clear goals and timelines for each phase in the PMTA review process, the center would enjoy a much more structured approach, and applicants would understand the progress of their applications. Currently, the lack of transparency in the review process leaves industry uncertain, which discourages investment in innovation of new and potentially reduced harm products. The second question I'll answer is, are there any important features, activities, or initiatives not encapsulated by these proposed goal areas that you believe CTP should consider as part of a strategic plan? The answer is yes, and we can look to other centers again for guidance. In its 2018 to 2020 strategic priorities, the Center for Devices and Radiological Health set the goal of simplicity. This stems from the recognition that while the issues they deal with are often complex, the solutions and processes used to address them don't necessarily have to be. CDRH's goal of simplicity was supported by developing decision aids to assure that anyone who would apply the policy in a given case will arrive at the same outcome. Additionally, CDRH reevaluated every device type under a pre-market application to determine whether CDR should stop requesting certain data, shift some pre-market data collection to post-market setting, or keep the regulatory approach as is. CTP could benefit from a similar approach to consider the different categories and subcategories of tobacco products and requirements for each. By simplifying the process for products lower on the continuum of risk, CTP would encourage innovation and create opportunities for adult tobacco product users to potentially reduce their individual risk. On behalf of CMSA and its members, I thank you for your work on this important effort and for the opportunity to comment.
Thank you for your comment. I'm Vanessa Burrows with the FDA. I will be moderating for the next hour. Thank you, Ashley. Next up is Joseph Manupello. Please identify the organization you represent or identify if you are speaking as an individual. You will have 4 minutes to comment. You may proceed.
Sorry about that. Can you hear me? Can you hear me?
Yes, we can.
Thank you.
Yes, we can.
Thank you. Good afternoon. I'm Joe Manupello with the Physicians Committee for Responsible Medicine. Thank you for the opportunity to comment. PCRM welcomes CTP's initiative to develop a 5-year strategic plan to advance its mission. PCRM appreciates CTP's progress in supporting the replacement and reduction of animal use in testing. The strategic plan offers the opportunity to further this progress by prioritizing communication that minimizes animal use under the first proposed goal area: develop, advance, and communicate comprehensive and impactful tobacco regulations and guidance. While FDA has consistently stressed that information from non-clinical studies alone, including from animal toxicity studies, will generally not suffice to support its determinations, in its regulations and guidance, it has also maintained the possibility that it might in some cases. Tobacco product manufacturers' uncertainty over CTP's expectations has already resulted in thousands of animals being used in tests that it does not appear to have needed. I'll illustrate with 2 brief examples from CTP's experience regulating ends to date. Through FOIA, we obtained non-clinical study reports submitted with PMTAs for ENDS from Logic Technology and Enjoy. Logic tested 10 ENDS products and Pall Mall Red King's combustible cigarettes on 2,393 rats. These were nose-only exposures where rats are constrained in tubes for 6 hours every day for up to 90 days and forced to inhale, test, and control substances. By contrast, NJOY submitted only reports from Caresta's standard in vitro test battery that measures cytotoxicity and mutagenicity. Both applicants' ends are similar, consisting of a reusable battery and a pre-filled disposable capsule or pod. While CTP says that this animal testing provided evidence supporting its determination, it did not discuss whether the definitive clinical studies could have stood alone. That NJOY's ends were also approved just 1 month later without animal testing raises the question of whether CTP needs any animal test data for ends. As information is available on fewer than 50 approved PMTAs out of the 19 million submitted, it's virtually certain that far more animals are being used. In the second example, Jewel Labs Incorporated attempted to address positive in vitro genotoxicity results by conducting in vivo genotoxicity tests for 2 products. CTP claimed that while negative results were accepted as final, positive results were rejected and products reevaluated more rigorously, including in animal testing. It concluded that it was not scientifically sound to accept the negative results from the in vivo genotoxicity studies without justifying why the positive in vitro results were rejected, and these results should have been accepted. Had CTP's concerns been effectively communicated to JLI and other manufacturers in advance, this animal testing could have been avoided. Along with our continued support for restricting the use of characterizing flavors, adopting broad product standards, and encouraging the use of TPMFs, PCRM recommends that in its strategic plan, CTP considering developing supplemental guidance on when new non-clinical information should be developed and on the types and sequence of studies that applicants should consider. In addition to minimizing animal use, clearly communicating CTP's expectations would facilitate FDA's timely and consistent reviews of marketing applications, improve manufacturers' compliance, and avoid legal challenges to its determinations, ultimately preempting the need for robust enforcement actions. It would also free resources to more effectively advance CTP's mission to protect Americans from tobacco-related disease and death by focusing on products that pose grave health risks, including combustible cigarettes. Thank you, and we look forward to continued.
Thank you for your comment. Up next is Erica Sward. Please identify your organization or if you are speaking as an individual. You will have 4 minutes to comment. Please proceed.
Good afternoon. My name is Erica Sward and I am with the American Lung Association. We applaud CTP for initiating the strategic planning process, and we look forward to submitting written comments as well. CTP is correct to put transparency, health equity, science, and engagement as cross-cutting themes as part of its new strategic plan. However, as CTP prioritizes stakeholder engagement, it must adopt a different way to deal with industry. The tobacco industry is unlike any other industry FDA oversees, and after all, the major cigarette companies are convicted racketeers. There are no shared goals or priorities between CTP and regulated industry, and if it appears there are, then that should be a red flag. The industry does not share CTP's mission of protecting the public health or any individual's health either. Companies and their representatives should not be considered in the same category or level of stakeholder moving forward, and the same level as public health and medical groups. Furthermore, none of the regulated companies and their industry partners share FDA's goal of health equity. The companies and their industry partners, including distributors, wholesalers, importers, marketers, retailers, and others, have preyed upon youth and marginalized communities, including Black and Brown communities, rural communities, Native Americans, and LGBTQ+ people, to name a few. This has further exacerbated systemic health disparities within these communities and others, including those with mental health and substance use disorders. The single best action FDA can take to advance and promote health equity is to finish and implement the 2 rules that would end the sale of menthol cigarettes and flavored cigars. Based on industry's reaction to these 2 rules, both today and in general, they too recognize how impactful these rules would be in improving health. State and local public health departments, including other public health organizations, cannot support CTP, its mission, and our collective efforts to promote and improve the public health unless FDA transparency is improved and more information becomes publicly available. CTP must increase its transparency in regulatory decisions, especially concerning product applications and the pending status of these applications. Moving forward, FDA should drop the FOIA requirement for an individual to learn if FDA has investigated or pursued a reported violation. The Lung Association is generally supportive of CTP's 5 proposed goal areas and find them consistent with its congressional mandate. However, the Lung Association strongly urges reconsideration of and revisions to part of Goal 4, notably any promotion of the so-called relative risk of tobacco products. FDA should have no part in the industry's efforts to sustain addiction through the failed and flawed notion that adult smokers should switch to e-cigarettes. Appropriate for the protection of the public health does not include FDA pushing a tobacco product that has initiated and maintained the addiction of millions of people because our public health and health systems have systematically failed to help tobacco users quit, and because both smokers and some in the public health community are desperate for something to change that. Cessation must only be defined as ceasing the use of all tobacco products, not switching to another tobacco product. The long-term public health and disease consequences associated with e-cigarette use, especially youth initiation, will continue to be learned the hard way, and CTP must not be further implicated in this debacle. Thank you for the opportunity to speak today.
Thank you for your comment. Up next, we have Rachel Boykin. Please identify your organization, or if you're speaking as an individual. You will have 4 minutes to comment. Please proceed.
Good afternoon. My name is Dr. Rachel Boykin, and I am the chair of the American Academy of Pediatrics section on nicotine and tobacco prevention and treatment. I am also a practicing pediatric hospitalist and tobacco control researcher. The Academy commends the FDA for undertaking the development of a strategic plan to guide the Center for Tobacco Products work over the next 5 years and appreciates this opportunity. Effective regulation of tobacco products by the FDA is essential to reducing youth initiation and tobacco product use among young people. The FDA has already undertaken multiple high-impact regulatory efforts that will dramatically improve public health and safeguard young people. Over the next year, it is critical that FDA get the job done on these efforts. First, it is imperative that FDA finalize and implement the proposed rules issued last year to prohibit the use of menthol flavoring in cigarettes and all flavoring in cigars. These historic proposals have the potential to dramatically reduce youth smoking initiation by removing from the market the products that are most attractive to young people, and to improve health equity by redressing decades of discriminatory marketing practices targeting communities of color with these products. We appreciate the FDA's important work on the menthol cigarette and flavored cigar rules and urge you to finalize them as soon as possible. FDA must prioritize the important work that will be needed to implement these rules. Such a significant change to the tobacco product marketplace will require extensive public education efforts to help the public understand the rules, why they were put in place, and how they will and will not be enforced. The FDA must also be prepared to vigorously defend these rules against potential industry challenges. For smokers whose preferred products are no longer available, it is also imperative that the FDA, working with other federal agencies, ensure widespread availability of evidence-based cessation therapies. Second, FDA must complete the pre-market review process for all e-cigarettes. Since 2020, FDA has been accepting and reviewing applications for thousands of e-cigarette products, many of which have been on the market without the required authorization from FDA. We are grateful for the FDA's work to process this backlog of applications and issue science-based decisions about whether the sale of specific e-cigarettes is in the interest of public health. We understand that FDA projects completing this process by the end of the year, and we urge the agency to do so as soon as possible and to reject applications for all flavored products. FDA must also prioritize enforcement efforts to ensure that only authorized products remain on the market. To date, many e-cigarettes that have been rejected by FDA remain. We urge the FDA to take legal action to the fullest extent authorized by the law to remove all unlawful products from the market. And FDA should make a list widely available of the limited set of products that have received a marketing authorization so the public can be aware of which products are and are not being sold legally. Pediatricians are particularly concerned about disposable and synthetic nicotine products, which are popular among youth and which contain extraordinarily high concentrations of nicotine. The health consequences from youth using these products cannot be understated. The risks of nicotine to the adolescent brain are well known. Today, we see more severe dependence and addiction in our youth than ever before. This issue requires urgent action from FDA. As FDA works to get illegal products off the market, enforcement should focus initially on these most harmful and youth-appealing products to maximize the public health impact. Tobacco companies continue to shift their product offerings and exploit loopholes in regulation. We urge the FDA to develop a mechanism to anticipate industry changes and future product trends such that regulation is happening on a proactive rather than a reactive basis. In closing, the FDA has an incredible opportunity in front of it to reduce the disease and death caused by tobacco products. The Academy looks forward to working with you to advance to our shared public health goals. Thank you.
Thank you for your comment. Up next, we have Brian Bird. Please identify your organization or if you're speaking as an individual. You will have up to 4 minutes to comment. You may proceed.
My video. Hi, everyone. This is Brian Bird. Can you hear me all right?
Yes, we can.
Okay, terrific. So my name is Brian Bird. I'm speaking on behalf of Chemular. We're a regulatory consulting group solely focused on the tobacco and nicotine space. I'm grateful for the opportunity here to participate in the listening session by the Center for Tobacco Products. We've attended a lot of the major tobacco science conferences, industry conferences, trade shows, anything else we can for the last 7 years. We've got a great team of toxicologists, chemists, quality specialists, publishers, every discipline to assist with federal tobacco regulations. We've been a keen observer of the CTP, and we feel we're in a pretty unique position to provide some great input on how the CTP can improve their current regulatory process. The Reagan-Udall report was a great first step. I think some of the things that were buried in that, there were some comments by FDA staff and others, and it oftentimes, inexplicably in my opinion, gets overlooked that the current CDC website shows over 480,000 Americans die annually from cigarettes, directly or indirectly. And this seems to be, should be stated in every document, in my opinion, and should be the main purpose of the CDC or the CTP to reduce death of Americans from cigarettes. Earlier on, Director King, his opening remarks wanted forward-looking comments only. So here's my forward-looking comments. The number one CTP goal that they listed out was tobacco regulations and guidance, if there was any comments on that. So no doubt the guidance framework needs to increase its clarity, the predictability and transparency with respect to the scientific benchmarks governing the application review. General statements in the guidance such as make your product appropriate for the protection of public health, very vague. Many people interpreted that to be just make it safer than a cigarette. Again, we noted kills almost 500,000 people annually, but it ended up turning out that APPH meant APPH plus flavors need to show incremental benefit over tobacco flavors and outweigh that risk to youth. So very clear guidance would be helpful to the industry. Another quick example, you had to demonstrate that former and never smokers were not interested in your product. Well, what does not interested mean? How do you demonstrate not interested? So having very clear guidance would be helpful. The goals for application product review, it'd be great if the CTP was more transparent in showing where their status, these companies' statuses are. We've had 2 to 3 years with some companies that have no communication. So being more transparent in the status would be helpful. We'd also like them to push more on a continuum of risk for the tobacco products, showing that cigarettes are the most harmful and there are other alternatives to move people down their tobacco journey. And lastly, in response to operational excellence, we would recommend that the CTP set up a dedicated team of stakeholder engagement. And I think that's my last minute. Am I out here?
Thank you for your comment. Up next, we have Cynthia Stanford. Please identify your organization, or if you are speaking as an individual, you will have 4 minutes to comment. You may proceed. Is Cynthia Stanford available to comment? Is Cynthia Stanford in attendance and available to comment?
Oh my gosh, can you guys hear me?
Yes, you can. Please proceed.
Oh, wonderful. Thank you for waiting for me. I don't know what happened with my connection. My name is Cindy Stanford, and I am an individual, but I'm also an owner of an e-liquid company that filed 2 PMTAs, and the failures made by the CTP has bankrupted my company due to improper application review and misstatements of the youth vaping epidemic. I believe the CTP continues to ignore the fact that vaping is a verb, and what youth are vaping is THC, drugs, spice, and other black market unregulated products. This has been confirmed by the CDC after they made erroneous claims about vaping and the Valley epidemic. I think this ignorance is using children as a shield in preventing tobacco harm reduction products from moving forward and further harming the adult smokers who could use or could benefit from flavored nicotine products. Flavor bans and prohibition do nothing for public health, and flavors are instrumental for adults to be successful in transitioning from deadly, combustible, carcinogenic, tar-filled cigarettes to something less harmful. I ask again for the CTP to look to the UK for guidance. The UK's forward-thinking and caring tobacco harm reduction has allowed them to place flavored e-liquid nicotine vapor stores in places such as hospitals. The only difference between the UK and the USA is the Master Settlement Agreement funds. The UK takes no funds from this agreement and regards public health higher than monetary funding, which is very disturbing as an American citizen, an ex-smoker, and an ex-business owner. Thank you for letting me speak.
Thank you for your comment. Guy Bentley, you are up next. Please identify your organization, or if you're speaking as an individual. You will have 4 minutes for your comment. Please proceed.
Thank you so much. Can you hear me?
Yes, we can.
Perfect. Thank you so much. Good afternoon. Thank you for the opportunity to provide comments on CTP's strategic plan. My name is Guy Bentley. I'm Director of Consumer Freedom at the Reason Foundation, and we're a nonprofit public policy think tank. As part of its mission to communicate comprehensive regulations and guidance, CTP needs to state clearly what are and aren't its overarching goals regarding tobacco product regulation. The mission that most coherently adheres to the letter and the spirit of the Tobacco Control Act is to reduce the burden of tobacco-related death and disease while adhering to the limitations set out in the TCA. These goals, however, should not be mistaken or blurred with unrelated or undesirable goals to eliminate non-medicinal nicotine use in the adult population, as this is both unachievable and does not align with Congress's intention when it passed the TCA. It should be made clear by CTP in its strategic plan that this is not its mission or intention. Regarding the PMTA review process, it's clear that as currently constructed, it has worked as an enormous barrier to entry for safer alternatives to cigarettes, advantaging large tobacco industry incumbents. It's neither sustainable nor desirable for products with similar toxicological profiles and risk liabilities to those already authorized by FDA to fail to gain authorization because they do not have the resources to comply with current pathways. As the Reagan-Udall evaluation suggested, CTP must clarify in guidance the specific data expectations and consider whether certain products would benefit from the creation of new pathways established based on currently scientifically supportable standards. As the RUF suggests, CTP should consider adopting processes by which products may secure authorization and then serve as model product submissions or be used to establish review expectations for similar products, much like the predicate approach path that exists in the substantial equivalence route. The slow progress on reforming product pathways is especially pressing as the agency prepares to publish its rule banning menthol cigarettes, as not a single menthol e-cigarette has been authorized, despite a large portion of the projected gains of the menthol ban derived from menthol smokers switching to menthol-flavored ends. Furthermore, the goals of greater compliance and enforcement FDA outlines cannot be divorced from the current dysfunction in the application review process. They are in reality indivisible. The FDA can't celebrate on the one hand more than 99% of PMTAs being rejected and decry the proliferation of the illicit market for ends on the other. The greatest enforcement and compliance mechanism is a well-functioning, intelligible, scientifically sound authorization process. Regarding the FDA's fourth strategic goal in enhancing public understanding, Brian King recently noted in a commentary that only around 10% of smokers believe e-cigarettes are less harmful than combustible cigarettes. Dr. King suggests there are opportunities to educate adult smokers about the relative risks of tobacco products, particularly e-cigarettes, and it's heartening to see this problem addressed. Given these figures were cited by Dr. King as being of specific concern, over the next 5 years, FDA should aim for a complete reversal of these misperceptions as part of its strategic plan, so that within 5 years, fewer than 10% of smokers believe ENDS products are just as or more dangerous than cigarettes. Finally, on advancing operational excellence, it's misguided to prioritize workforce growth. The agency's success should be measured on outputs, not inputs. Larger budgets and more staff should not be a priority in and of themselves. Instead, reforming application pathways should mitigate the need for additional funding or additional staff. Thank you so much for your time.
Thank you for your comment. Up next, we have John Adler. Please identify your organization or if you are speaking as an individual. You will have 4 minutes to comment. Please proceed.
My name is John Adler, and I'm the current national president of the Federal Law Enforcement Officers Foundation, which provides support to federal officers from 65 different agencies. I'm also the former director of the Department of Justice Bureau of Justice Assistance, which is the federal agency administering the largest grant programs for the criminal justice system and provides training and technical assistance and policy development. During my law enforcement career, we learned that we cannot arrest our way out of the drug crimes problem. Drawing on lessons learned, we cannot ban our way out of the smoking health-related problem. The FDA's 5-year plan should not include current plans to remove legal regulated tobacco products from sale. This would lead to the unintended consequences of empowering illicit markets, circulating unregulated harmful poison puffs, and placing additional strains on police-community relations. According to FDA's published summary, FDA's enforcement of this proposed rule will only address manufacturers, distributors, wholesalers, importers, and retailers. These are pleasant business terms that ultimately refer to cartels, gangs, smugglers, and countries adversarial to our nation's interests. What is the plan for stopping them, and where are the law enforcement assets that can investigate and enforce this rule? Goal Area 3 states, ensure compliance of regulated industry and tobacco products utilizing all available tools, including robust law enforcement actions. Who specifically is going to initiate these robust actions? Law enforcement assets nationwide are at historical staffing lows. Every chief, director, and sheriff have to prioritize their law enforcement assets towards violent crime and top areas of concern. This rule will likely lead to another unfunded federal mandate, and finding anyone to initiate robust actions would be like searching for Where's Waldo. As the saying goes, history repeats itself, and so do criminals. Looking at the period of prohibition from 1920 to 33, the ban of alcohol products led to the empowerment of organized crime. The ban did not make the demand disappear. Tragically, the situation led to a drastic increase in law enforcement fatalities, with 316 officers killed in 1930. It also resulted in Americans becoming ill after drinking unregulated alcohol products. By way of comparison, we see how individual cigarettes called loosies are sold in poorer communities. If tobacco products were banned, this would increase the sale of loosies, which would now be unregulated cigarette-type products smuggled into our country. These illicit loosies are typically front-loaded with tobacco and then filled with any leafy, grainy, or possibly toxic substance. We do not want our children smoking poison puffs, and we do not have any robust means to prevent them from getting into the poorer communities. We have experienced an unprecedented number of drug overdose fatalities in the past 5 years, many attributed to fentanyl. What doesn't get discussed is that drug users often have no idea what they're actually taking, and they run the risk of inhaling, shooting, or injecting a drug buffet of death. And we do not want our children or adults smoking mystery loosies. It would make better sense to continue coordinating with community leaders, law enforcement, and the tobacco industry to discuss harm reduction initiatives. It seems that FDA has not convened the requisite group of law enforcement leaders to provide guidance and explain the inevitable negative consequences of a ban. I strongly urge the FDA to engage with the leaders of the International Association of Chiefs of Police. This nonpartisan professional association represents police chiefs nationwide and can offer meaningful input. The same goes for the National Sheriff's Association. They take an evidence-based approach towards researching and evaluating the anticipated impact of prospective policies on law enforcement resources and community relations. Please engage with the IACP and the NSA and any other national law enforcement leader that is dedicated or in a dedicated environment to discuss this goal area and the broader impact a ban will have on policing.
Thank you for your comment. Up next, we have Doug Cantor. Please identify your organization, and if you are speaking as an individual, you will have 4 minutes to comment. Please proceed.
Hi, my name is Doug Cantor. I am General Counsel of the National Association of Convenience Stores. Thank you for the opportunity to present today. For retailers like convenience stores that sell tobacco products, their top priority is to do that in a responsible manner. And that means, to the greatest extent possible, restricting youth access while legally selling these products to adult consumers. As you heard from a number of folks today, there have, in fact, been some very real achievements on that front in reducing youth access to tobacco products over time. And we should build on that success, and we urge CTP to build on that success. A couple of things I would note. One, you've already heard from a number of folks who have warned about the dangers of an illicit market developing and increasing if menthol cigarettes are banned, if flavored cigars are banned, and if nicotine in tobacco products is reduced. I would take that threat seriously. There's already a very large illicit market built around other things like tax avoidance. And so the mechanisms are in place. It's a real danger, and the illicit market does not prioritize or care at all about limiting youth access. It will be a tremendous detriment to that goal if we go down that road and the illicit market grows. But we're also at a moment where compliance in these areas is changing. It's changing because the primary method by which retailers verify age in order to prevent youth access is the driver's license. And more states are now beginning pilots and will soon move into mobile driver's licenses that appear on cell phones. And that new technology will bring additional complexity to it. It will change the compliance atmosphere. And I urge CTP to look at this very closely. Here at NACS, we've developed a technology product, TrueAge, in order to assist with that transition and allow for electronic verification, both of current driver's licenses, but also with a view to the future and be the cutting edge way to verify age. You heard my colleague Lyle Beckwith speak earlier about the WeCard program. WeCard has been out there for decades, and it keeps at the cutting edge of how to comply and keep up with new things that are happening in the marketplace and new technologies that are going on. We urge you at CTP to engage in rulemaking and guidance to approve training and compliance programs. To date, what the CTP has put out has been much too complicated. It does not make clear what programs are fit to use and what programs are not. It leaves it to retailers to figure out, and that is not sufficient assistance. There needs to be a real incentive for the best compliance possible, and CTP needs to point the way by showing, if they're good enough, programs like WeCard, technologies like TrueAge, and being more specific with the market about the best ways to reduce youth access to these products. Thank you very much for your time.
Thank you for your comment. Up next, we have Greg Wilson. Please identify your organization or if you are speaking as an individual. You will have 4 minutes to comment. Please proceed.
Great, thank you. I'm Greg Wilson. I'm the Vice President of Regulatory Affairs with Altria, and I appreciate the opportunity to share a few thoughts with you today. In announcing this session, FDA posed several questions, and while we intend to submit comments to the docket that's been open, I'll use my time here today to really address the specific question that FDA posed around what 3 specific actions can CTP take in the next 5 years that will have the most impact. The first action that CTP or FDA should take is to enhance the PMTA pathway by clearly defining the APPH standard, including providing category-specific details of the scientific evidence that FDA believes is necessary to meet that standard. Also, sharing details on how FDA evaluates and balances the risk-benefit analysis that is inherent in the APPH standard, providing actionable feedback to manufacturers so that they can submit complete and relevant product applications, leveraging post-market surveillance authority to monitor for unintended consequences rather than delaying or denying PMTA authorizations, and implementing the supplemental PMTA pathway in a way that accelerates harm reduction. Most importantly, and in conjunction with providing that level of clarity on the PMTA process, we believe that FDA should move more rapidly to complete timely reviews and authorize more smoke-free products that offer significantly less risk for the approximately 30 million adult smokers in this country, including those that otherwise won't or cannot quit use of tobacco products. Over half of these adult smokers are seeking reduced risk products and alternatives, and no one product is going to satisfy all adult smokers. Smokers have made clear their interest in having an array of smoke-free products, including flavors and a variety of product platforms. The need for an array of smoke-free products that can satisfy a range of adult smoker preferences is especially urgent in light of US public health disparities. It's imperative that there is a fully regulated marketplace of authorized smoke-free products that are both satisfying and appealing to adult smokers if we're going to make meaningful progress on reducing the harms associated with cigarette smoking. And that brings me to the second action that we believe FDA should take that will have a significant impact, and that would be to launch comprehensive and sustained public health communications that are aimed primarily at the 30 million adult smokers in this country that can address the widespread misperceptions that exist regarding nicotine and the overall relative risks of different tobacco products. Unfortunately, the majority of adults who smoke think that smoke-free products are equally or more harmful than cigarettes. Left unaddressed, these misperceptions are a barrier to realizing harm reduction in this country. Finally, the third action, we strongly encourage FDA to accelerate its compliance and enforcement. A fully regulated and enforced marketplace assures FDA oversight of all tobacco and nicotine products sold in this country. Unfortunately, today, there are a significant number of products in the market illegally and operating outside the regulated market. As you've heard today, responsible retailers and wholesalers are asking FDA for guidance on which products can be sold. FDA should publish a list of products that can continue to be sold pending pre-market review, and FDA should partner with other federal agencies to take aggressive actions against those operating outside the regulatory system. With the right strategic priorities, US FDA can create a well-regulated marketplace that can serve as a model for positive, sustained public health impact. That includes authorizing reduced harm products for adults, establishing clear compliance standards for regulated parties, defining appropriate guidelines and marketing practices for innovative smoke-free products, maintaining strong youth prevention efforts, and pursuing enforcement actions. Thank you for the opportunity to share these comments, and we look forward to seeing more details as FDA continues to define its strategic plan.
Thank you for your comment. Up next, we have Diane Goldstein. Please identify your organization or if you are speaking as an individual. You will have 4 minutes to comment. Please proceed. Diane, are you available to make a comment?
Can you hear me?
Now we can hear you. Please proceed.
I'm so sorry. I wasn't supposed to be on for another 20 minutes. So my name is Diane Goldstein. I'm currently the executive director of the Law Enforcement Action Partnership. As a 21-year policing veteran, I'm writing to express my concerns with FDA's proposed menthol ban. Based on my experiences, I believe this policy would worsen police community relations and lead to more problematic encounters between law enforcement and communities of color. Reacting to concerns previously mentioned from some law enforcement and civil rights activists, FDA has stated it would enforce the prohibition only against menthol cigarette manufacturers and distributors, not individual smokers. However, this fails to account for the fact that all 50 states treat the sale and distribution of illicit cigarettes as a serious crime. Street level policing has never been under the influence and control of the FDA. When Eric Garner was killed in New York City for selling untaxed cigarettes on the street in 2015, it was a case of local police enforcing a state law. If menthol cigarettes became illegal, the FDA will have no ability to prevent the resulting local enforcement efforts. If the nation's illicit drug market is any indication, the people who would operate an illicit menthol market at the levels most susceptible to police enforcement will be from the communities the market serves, which in this case are overwhelmingly Black and Latino. Since the beginning, FDA has failed to listen to law enforcement's concern with the proposed menthol ban. And recently, the FDA has gone further and announced its intention to ban the entire cigarette category, resulting in complete prohibition of an $80 billion market, which we are turning over to cartels and bad actors, which would turn over to cartels and bad actors. The FDA has also failed to acknowledge the potential for significant illegal market activity that will result from such a ban. The FDA's prohibition-based policies are remarkably like a path we've been down before, and that has led to harmful places for communities of color. Given the demonstrated resilience of the demand for mentholated tobacco and nicotine products and the immense nationwide market that stands to be erased overnight, at least one outcome seems inevitable. People in communities of color that are marginalized standing on street corners selling illicit substitutes. There is no reason to think local businesses and officials won't take note and call for action like they currently do. Enter the police. History has shown us how this often ends. Instead of prevention and criminalization, FDA should address smoking addiction through a public health model consisting of policies such as harm reduction, education, cessation support, and youth tobacco prevention. My organization and other law enforcement leaders ask that the FDA conduct meetings and/or focus groups with experienced law enforcement unions and personnel at the local, state, and national levels to understand what enforcing menthol and flavored cigar bans would mean to their day-to-day workload, community relations, goals, and crime deterrence strategies. Regrettably, the FDA moved forward to this stage of the rulemaking process without meaningful strategic engagement with the men and women of law enforcement who will ultimately be responsible for enforcing product bans at the local, state, and federal level. Thank you very much for your time.
Thank you for your comment. We will be taking a break now and then going into the final hour of the listening session. So we ask that the remaining commenters be prepared once we resume. We will regather at 2:50.
All right, thank you. We have commenters left today for our session. Thanks for being a little bit early with us to start. Our first person is Elizabeth Hicks. Please state your organization and whether you are speaking on your behalf or for your organization, and you have 4 minutes. Please proceed.
Thank you. I'm Elizabeth Hicks on behalf of the Consumer Choice Center. As a consumer advocacy group that fights for lifestyle freedom, innovative technologies, and smart policy, we appreciate the Food and Drug Administration's open call for public comment to guide the direction in which the Center for Tobacco Products is heading. I'll be outlining 3 recommendations that we believe will reduce the number of tobacco-related deaths and illnesses and ultimately help the agency improve public health within the next 5 years. The first recommendation is to embrace harm reduction by acknowledging that scientific evidence showing vaping is 95% less harmful than smoking, and that flavored vaping products play a key role in getting consumers to stop smoking combustible tobacco. Rather than continuing down the road of prohibition, the FDA has an opportunity to follow in the footsteps of other global health regulators by embracing and promoting less harmful nicotine alternatives like vaping. Public Health England announced in 2015 that studies showed vaping to be 95% less harmful than smoking. Since then, the UK government continues to study the effects that vaping has had on public health and produces their findings annually. The latest report shows that flavored vaping products, specifically fruit and menthol and mint flavors, remain the most common aid used by people to help them stop smoking combustible tobacco. More recently, the UK government doubled down on its harm reduction strategy through vaping by encouraging 1 million smokers to swap their cigarettes for a free vape starter kit, providing financial incentives to pregnant women to quit smoking, as well as introducing mandatory informative inserts about vaping into packages of cigarettes. Our second recommendation is to spread awareness of other less harmful nicotine alternatives to combustible tobacco, such as nicotine pouches, snus, gums, lozenges, and others. Although vaping is arguably the most popular and effective technology to move consumers away from combustible tobacco, other nicotine alternatives also exist and should be embraced. We can again look to global public health counterparts and follow in their successful footsteps, like Sweden. The World Health Organization recently announced that Sweden will likely become the first smoke-free country. Sweden has embraced the concept of tobacco harm reduction and supports its citizens to switch from cigarettes to less harmful alternatives, including vaping, nicotine pouches, and snus. Consequently, Sweden has reduced its smoking rates 2 times faster than any other country in the European Union, and smoking rates have declined by 55% in the last decade. Additionally, smoking-related deaths are 22% lower in Sweden than the EU average, and cancer incidence is 41% lower than the rest of Europe, with total deaths from cancer being 38% lower. Nicotine pouches and snus are gaining popularity and provide consumers with additional options and choices to move away from combustible tobacco. While gums and lozenges are less popular among consumers, they still pose a very versatile contribution to ending smoking. It'll be crucial for the CTP to focus its regulatory scope to general product safety while continuing to listen to consumers in regard to the types of products that should be available. Our third and final recommendation is to streamline the PMTA process to allow more tobacco harm reduction products into the marketplace within a timely manner. Despite vaping manufacturers meeting PMTA requirements to scientifically demonstrate how their products enhance public health, the FDA has failed to approve thousands, if not more, of these products. Keeping alternative nicotine products out of the marketplace that meet the requirements outlined in the PMTA process only emboldens the illicit market to fill the void for consumers. This poses serious public health risks as bad actors could sell faulty products that result in negative impacts for individuals. It's also important to note that the illicit market does not perform age verification, making it much easier for youth to acquire these products. The FDA should instead simplify and streamline the PMTA process to ensure that any product which meets the standards outlined by the CTP receives immediate approval. Additionally, more transparency from the agency regarding approvals, denials, standards, and timelines would be helpful in ensuring that manufacturers can provide the necessary materials within the PMTAs so that their products can reach and benefit consumers as quickly as possible. Thank you for the opportunity to comment today and happy to answer any questions.
Thank you, Elizabeth. Next up, we have John Bowman. John Bowman, please state your organization or share that you're speaking as an individual. You have 4 minutes to comment. Please proceed. Excuse me, please proceed. John Bowman, we see that you're on, John. Might want to take yourself off mute.
Yeah, can you see me? Hello?
Yes, we can see you and hear you, sir. Go ahead.
Great. John Bowman, I'm the Executive Vice President for U.S. Programs at the Campaign for Tobacco-Free Kids. I want to thank CTP for giving us the opportunity to provide our views. My comments are going to focus on 3 of the goals set out for public comment: regulations, application review, and enforcement. In each of those areas, the central objective of the strategic plan should be to assure that the FDA's statutory authority is used to the fullest extent to protect the public from any threat posed by tobacco products. Perhaps the most impactful power given the FDA by the Tobacco Control Act is the ability to issue rules mandating product standards to make tobacco products less hazardous, less addictive, and less appealing. But in 14 years, CTP has yet to issue a single final product standard. This needs to change. The strategic plan should include a commitment to finalize rules to prohibit menthol as a characterizing flavor in cigarettes and prohibit all flavored cigars. And this needs to happen without further delay. Given the egregious targeting of the Black community by menthol cigarettes and flavored cigars, and the resulting disparate impact of those products on the health of the Black community, finalizing these rules will significantly advance the cause of health equity. That's why major organizations like the 100 Black Men of America, the Alpha Phi Alpha Fraternity, the Delta Sigma Theta Sorority, and the NAACP support the menthol rule, along with 32 members of the Congressional Black Caucus who recently signed a letter to the FDA supporting the rule. It also commit to issuing a proposed rule this year that would reduce nicotine in cigarettes and other combustible products to non-addictive levels. CTP has estimated that over time, this product standard applied to cigarettes would save lives. FDA Commissioner Califf has pledged to issue a proposed rule, and this commitment should be reflected in the strategic plan. As to product application review, the priority must be to mandate that any new tobacco product must have the correct FDA marketing authorization order. Public health groups have alerted CTP for years about the appearance of new cigarettes, cigars, and smokeless tobacco products marketed as new, but without any marketing orders of any kind. That said, clearly FDA's most widespread failure to implement pre-market review has occurred with e-cigarettes, where millions of flavored e-cigarette products, highly attractive to young people, have been sold without FDA review for years. We are encouraged that CTP has now denied marketing applications for millions of flavored products, and that the courts are upholding these decisions. CTP must commit to finishing the job without any further delay, ensuring that going forward, pre-market review is no longer post-market review. Finally, as to enforcement, the strategic plan must confront the reality that virtually all e-cigarettes on the market are illegal since they lack the required marketing orders. Clearing the market of these illegal products must be a priority, not only of CTP, but the entire administration, to include the Department of Justice. The administration must be prepared to use all available enforcement tools, going beyond simple warning letters and using injunctions, substantial civil penalties, import restrictions, and others. Thank you for the opportunity to share our views. We stand ready to help CTP develop and implement the authority that has been given to protect public health.
Thank you, sir. Andrew Perot or Perot. Andrew, you are up next. Please state your organization and whether you're speaking as an individual or for your organization. Again, you have 4 minutes, and please be ready to proceed. I see you. There we are. Perfect.
Hi, my name is Andrew Perot. I'm presenting today on behalf of Cigar Rights of America. CRA is a consumer-based public advocacy group dedicated to protecting the interests of premium cigar manufacturers, retailers, and consumers. CRA is currently the world's largest coalition of premium cigar manufacturers and consumers, with a membership that spans all 50 states and represents over 60 diverse artists and producers of handmade premium cigars. In the wake of the Reagan-Udall Foundation's report on the effectiveness of the Center for Tobacco Products, we commend the agency for undertaking this comprehensive exercise and setting goals and priorities for the coming 5 years. CRA has 2 broad suggestions for CTP. First, FDA should prioritize regulatory action against products that pose higher risks to human health or risks of youth appeal. CRA has long contended that premium cigars are a distinct category of tobacco products. Since the original publication of CTP's deeming rule, we have argued, drawing on data from the National Cancer Institute, that there is nearly no detectable underage use of these products, that the evidence shows that the vast majority of smokers use premium products infrequently, and that while the population level health effects of these products remains understudied, the data we do have shows significantly lower morbidity and mortality than for other products in the combustible tobacco category. In short, we believe that the available science shows that premium cigars are correctly classified at the lowest level of what CTP has described as the continuum of risk for tobacco products. Since the publication of the 2014 deeming rule, scientific evidence has continued to accumulate to support that position. In March 2022, the National Academies of Science, Engineering, and Medicine, or NASEM, published a comprehensive report on premium cigars, surveying the existing literature and making recommendations for future research. On July 28th of this year, the Journal of the Society for Research on Nicotine and Tobacco, SRNT, published an issue devoted solely to issues regarding premium cigars and their regulation. The data from those articles was largely drawn from NIH's most recent population assessment of tobacco and health study, and from similar high-quality data sources. Both the 2022 NASEM and 2023 SRNT research are consistent with the data that we have previously cited, showing no significant underage use, lower probable population health risks. It's notable that in each wave of additional research that appears, the evidence continues to strengthen. The case against these products are correctly classified at the lowest end of the continuum of risk. As such, we believe that it's a poor use of CTP resources to impose additional regulations or re-regulations on this small sector of the industry. We ask that FDA adhere to its own policy statements regarding the continuum of risk, rather than imposing one-size-fits-all regulations across products that bear very little similarity to one another. As such, we ask that FDA refrain from imposing additional regulations against this small, unique subsection of the industry. Our second recommendation is that FDA should follow the science and adopt a definition for premium cigars for research and regulatory purposes. There appears to be an emerging consensus among the public health community, the industry, and the courts that establishing premium cigars as a separate category is both scientifically appropriate and would assist FDA in efficiently promulgating and enforcing its regulations. Notably, both the NASEM report and the SRNT journal advocated for establishing premium cigars as a separate category for research and regulatory purposes. Further, the SRNT discussion indicated that FDA's conflation of those products with other tobacco categories has resulted in the failure to adequately regulate and restrict mass market cigar products that are more likely to be used by vulnerable populations. We believe that adopting an agency-wide definition would allow CTP to more clearly consider the costs and benefits of its regulation and to direct its administrative and enforcement efforts towards products that pose the greatest risk to public health. It would also assist FDA and other agencies throughout.
Thank you, Drew. Next up, we have Stanton Glantz. Please state your organization or share that you're speaking as an individual. You have 4 minutes for your comment. Please proceed. Stanton Glantz. Thank you, sir. We see you. Proceed.
My name is Stanton Glantz. I'm a retired UCSF professor of medicine. I served as the principal investigator for the UCSF course until I retired and continue to be involved with the UCSF course. As part of its strategic plan, CTP should establish a policy of prioritizing direct epidemiological population health measures or measures for both health and behavior over indirect measures or assumptions. And we've heard many of those assumptions in the presentation today. This would represent a substantial change. To date, the FDA has prioritized indirect evidence, most notably biomarkers, over population epidemiology. The rationale had been that new products have not been in widespread use long enough for health effects to be manifest at the population level. This problem certainly does not apply to e-cigarettes, which have been on the consumer market for 17 years, since 2006. There is now a large epidemiological literature on the health effects of e-cigarettes as they are actually used in the general population. It reveals elevated risk for cardiovascular, pulmonary, and oral diseases compared to non-users. Even more important, in contrast to the biomarker studies, human disease epidemiology shows that e-cigarette risks are similar to cigarettes for cardiovascular and oral diseases. And while e-cigarettes risks are lower for pulmonary disease, the risks are much higher than the FDA has assumed and that you've heard quoted from other speakers. Dual use of cigarettes and e-cigarettes, something the FDA needs to also pay more attention to, is associated with increased odds of disease for cardiovascular, pulmonary, and oral diseases. Likewise, there is a large literature that contradicts the assumption that e-cigarettes, when used by consumers, will result in switching completely from cigarettes. They do not. To implement the policy prioritizing direct measures of health and behavioral effects over indirect measures or assumptions, the FDA should make decisions about the risk of e-cigarettes and other established products based on documented effects on disease in the population, not just short-term measures from a limited number of cigarette biomarkers. FDA should heed its own meta-analysis and stop assuming that reducing but not stopping smoking substantially reduces risks. FDA should prioritize the effects of dual and poly-product use in regulatory decision-making and public communication. FDA should complete and publish its own risk assessment of the epidemiological evidence of disease risk associated with e-cigarette use compared to cigarette use and dual use compared to cigarette use in the general population. FDA should complete and publish its own assessment of the relationship between e-cigarette and other tobacco use among youth and young adults, particularly the extent to which e-cigarettes are attracting low-risk youth to nicotine. And FDA should stop making regulatory and public communications decisions, assuming that e-cigarettes as consumer products help people stop smoking until there is strong population-based evidence that that is correct. By prioritizing direct human evidence, the FDA will make much better
Thank you, sir, for your comment. Wayne Harris, you are up next. Please state your organization or share that you're speaking as an individual. You have 4 minutes for your comment. Please proceed. Wayne Harris. Wayne, we see you. Just need to get off of mute.
Good afternoon, and thank you for the opportunity to address you this today for this the CTP strategic plan. My name is Wayne Harrison. I'm a retired deputy chief of police with over 30 years of experience, and I'm speaking to you today in opposition to the FDA's plan to prohibit menthol tobacco. My 30 years of experience, I've seen the consequences of bad policy on our communities. And while I appreciate the FDA's purpose of improving the health of our communities, I caution them on using prohibition, which we have seen to be a failed strategy here in the United States. It failed with alcohol, it failed with the war on drugs. It has been previously mentioned by some of the other law enforcement speakers, it will in fact fail for menthol tobacco currently. So unlike some of the other speakers that have gone before me, many of them have talked about the possibilities of illicit markets occurring. I wanted to bring to your attention that in the states that have attempted prohibition such as this, those illicit markets are already established. In fact, in the state of New York, almost 50% of the cigarettes that are sold are untaxed. They're illegal, and they are already being sold illegally on the streets. My fear is that this particular prohibition will further exacerbate that problem. And when we're talking about law enforcement on a national scale, and please understand, I'm coming from this as a law enforcement professional, as a law enforcement expert. My opinion in smoking, I'm not a smoker. My opinion is you should ban it all if you're going to ban it all. But my purpose here is to say, let's not create a situation that is going to make a situation worse. The FDA has often said that this will be up to the health department to enforce, that it will only go after manufacturers and points of sale. What they have failed to understand, though, is that illegal markets will create violence, and similar to gang activity everywhere else in the streets, the victimization of our neighborhoods. That's what I'm trying to get them to understand. So I'm strongly encouraging the FDA to sit down with law enforcement, sit down with community leaders that are victimized in their own homes, sit down with activists that want to see our communities healthier, and work out a common sense policy that can address the issues that they're seeking to get a handle on. I also have a concern that race is being used as a determining factor here. I appreciate people wanting to support the Black community and make the Black community healthy, but if, for example, the Supreme Court has said that race can't be used as a determining factor for college admission, I'm wondering why we're suggesting that a federal agency can use race as a determining factor for a policy that it wants to issue. My recommendation is that we put a pause on this and not continue to move forward for something that is already showing to be a problem here in the United States. This is not a theoretical concern. This is something that's already happening. The other thing I want to mention is this, the final point. Simply prohibiting the manufacture will not address the Native American population that produces their own and frequently sells their own cigarettes to anyone that can go onto a reservation. So while the FDA's purpose is commendable, I don't think it's well thought out, and I think there's more work that needs to be done before any sort of prohibition such as this is implemented. I represent the Law Enforcement Action Partnership. I also represent the National Organization of Black Law Enforcement Executives. And we stand ready to sit and speak with you and try to work out a common sense policy. Thank you for an opportunity to speak with you today.
Thank you, Mr. Harris. Well timed. Up next, We have Ryan Potts. Please state your organization or share that you are speaking as an individual. You have 4 minutes for your comment. Please proceed. Ryan Potts.
Hello, good afternoon.
Good afternoon.
My name is Dr. Ryan Potts. I currently serve as Senior Vice President in the Scientific and Regulatory Affairs Group at REI Services Company, a subsidiary of Reynolds American. And thank you for the opportunity to provide public comments on CTP's 5-year strategic plan. Reynolds believe the agency should, 1, allow for efficient navigation of the application review process. Number 2, develop a strategy that encourages innovation. And 3, promote a well-regulated marketplace that discourages bad actors. So firstly, to allow for efficient navigation of the application review process, CTP should prioritize development of approaches to eliminate the current submission backlog at the agency. Now, while the agency has made some progress, it continues to face a significant backlog of applications. Indeed, presently there remain tens of thousands of PMTAs, SEs, and exemption requests in the queue. Based on the Center's current rate of action and a continued influx of applications, this backlog will take years to clear and will continue to impede the introduction of new non-combustive products that likely pose lower health risks than combustible cigarettes. There are over 13 million adult vapor consumers in the US, millions of whom are former smokers. Since 2016, FDA has authorized simply too few products to meet adult consumer demand, and this failure has undermined FDA's authority and directly fueled the exploding illicit market of flavored disposable products. Approaches to expedite elimination of the backlog could include far greater reliance on commercialization history and decreased cigarette smoking incidence data, as well as FDA's powerful post-authorization tools to closely monitor and regulate marketed provisional and deemed products to mitigate any risks of adverse impact, including underage use. Second, the agency should adopt a strategy that encourages innovation. CTP should establish an expedited notification pathway for safety and quality enhancements for products that have received an NGO. Such an approach will allow for continued product innovation and improvements beneficial to safety instead of having innovation lag years behind. Similarly, the agency should consider setting forth clear guidance that allows for certain minor changes to the design of a product without a pre-market notification. Clearer guidance would allow companies to maintain continuity of their supply chain and at the same time reduce the burden on the agency. Innovations, including those designed to prevent youth access, for instance, are being developed by several manufacturers globally, but the current PMTA process continues to delay availability of safety and quality enhancements available elsewhere. Submissions containing advances in technology, such as improvements in battery management or incorporation of youth access prevention technology, should have a similar accelerated notification pathway and should not be subject to a long, drawn-out submission process. Third, the agency should promote a well-regulated marketplace that discourages bad actors. In the modern cigarette, there's never been as many alternatives to the combustible cigarette that may present less risk, and smoking in the US is at all-time lows for adults and youth. A reduction in both smoking rates and prevalence of irresponsible market participants has been driven by a strong regulated system. Unfortunately, since 2020, the vapor category has been shifting rapidly to products made by companies ignoring virtually every rule the FDA has established. FDA must hold bad actors accountable and take direct action against them immediately. This should be an enforcement priority. Failure to do so undermines FDA authority and public confidence in the agency. Finally, FDA should publish a complete list of products with properly pending PMTA applications under review since September 9, 2020. In sum, Reynolds is committed to working with the agency and again.
Thank you, sir. And for our final speaker today, Alex Clark. Please state your organization or share that you are speaking as an individual. You have up to 4 minutes to comment. Please proceed, Alex Clark. Good afternoon.
Good afternoon. Can you hear me?
Yes.
Excellent.
My name is Alex Clark. I'm the CEO of the Consumer Advocates for Smoke-Free Alternatives Association. I'm here on behalf of our all-volunteer board of directors and our more than 270,000 members from all walks of life. We are consumers who have successfully switched away from or significantly reduced our consumption of combustible tobacco by using vapor or some other low-risk smoke-free alternative to cigarettes. I'd like to start by acknowledging that this listening session is a step in the right direction with regard to increasing stakeholder engagement, and we urge CTP to make this an annual event at least. Perhaps quarterly listening sessions would elicit more and higher quality feedback on a regular basis. I'll focus our comments on goals 3 and 4, and we'd also like to associate ourselves with several of the previous comments, particularly those calling for expedited authorizations for a variety of smoke-free vapor and oral nicotine products, including products and flavors other than tobacco, the availability of which is associated with the recent accelerated declines in smoking prevalence. As to goal 3, most of the conversation and the description of this strategic goal focuses on increasing enforcement capabilities, but it should be clear by now that as FDA tightens its grip on the nicotine market, the vacuum caused by enforcement actions creates opportunities for informal sellers. Moreover, it is well established that FDA cannot possibly police the entire industry, therefore relying on states and municipalities to conform regulations to the federal standard and choose their own enforcement strategy. In more than 2/3 of the country, purchase, use, or possession of nicotine products by youth is criminalized, which leads to other questions of public health. Much of the US is still living the fantasy that a drug war style approach to tobacco enforcement will have net positive outcomes. In order to avoid the known negative outcomes of strict unflinching enforcement, a robust and honest education and deprogramming campaign must be developed that includes useful information about modified risk products and encouragement for people who smoke to try multiple strategies, including the use of low-risk alternatives to cigarettes. As to goal 4, we want to acknowledge the $2.5 million funding opportunity to research messages about modified risk products. I think it's fair to say that this commitment is better late than never to figure out how to tell the truth about the risk continuum among nicotine products. We believe that this research must examine what's needed to undo misperceptions of risk associated with nicotine. And we're curious how youth uptake of nicotine products is weighted when assessing outcomes of these messages, and think it's vital to note that zero tolerance and capital T total abstinence are not realistic or even ideal outcomes. While the transparency promised by CTP is vital to repairing confidence in the center, so too is acknowledgement that doctor, patient, and consumer beliefs about the risks associated with nicotine are heavily influenced by misleading campaigns designed with the singular purpose of scaring kids away from tobacco or frightening adults to quit smoking. In order for any corrective, adult-focused communications about nicotine, specifically modified risk products, to be effective, prior misinformation and strategies to correct it must be identified, examined, and deployed. It is simply not enough to rely on third-party groups to disseminate accurate information about safer alternatives to smoking. FDA must take a leadership role in ensuring that consumers and healthcare providers are accurately informed about all strategies and products that can improve the health of people who smoke. Thank you for the opportunity to speak.
Thank you.
Hello all, I am Brian King. I'm the director of the Center for Tobacco Products, and that concludes our session for today. It is a wrap. Thank you all for participating, and we appreciate everyone who took the time to share their input with us, but also those who were just listening in. We did accommodate every request to speak today, so I know it was a long haul, and I appreciate everyone for sticking with us. It looked like we retained slightly over 50% that we started with, but glad that many of us stuck around for the entire day. As a reminder for those who would like to share your written feedback, the docket is open to submit written comments through next week, specifically August 29th. And after the comment period closes, FDA will review each comment along with all those shared today. And we're going to take that input into consideration as we continue to develop the new strategic plan, which we are on track to do by the end of this year. In the interim, we're going to continue to share routine updates with you all to communicate our progress on the strategic plan. I also want to remind folks about other upcoming opportunities for the public to engage with CTP, including a public meeting and interactive discussion on the pre-market tobacco product application review process that's slated for this fall. A save the date went out last week for October 23rd and 24th. And so some information on question submission and logistics is forthcoming, but please mark your calendars in the interim for this meeting. It's going to be in person at FDA's White Oak campus, but we will have a virtual option. I know there were a lot of comments today on that process, and we appreciate the opportunity for you all to share a little bit more granularity as well during that session. And before closing, I also want to give a profound shout out to all our stellar moderators, translators, behind the scenes folks who work so tirelessly to make today a reality. A lot of work goes into these sessions, whether they're in person or virtual, and we simply could not have done it without you all. So nicely done. With that, thank you all again, and I hope you have a good rest of your day. Bye.